you stories which are brighter than yesterday. The streets have never been so quiet. The squirrels found a new hideaway.
Tomorrow will never be the same. There is so much hope in our hearts. Brick by brick we shall overcome and walk right into a new start. Welcome to the brand new world. We're the children of our Mother Earth. Reach out your hands, let us see our earth together. Welcome to the brand new world. We're the children of our Mother Earth. Reach out your hands, let us heal our earth together.
We will heal the earth, heal the earth, heal the earth. We will heal the earth, heal the earth, heal the earth. Birds are flying strong and fearless. Green is greener in shrubs and trees. The skies have never been so clear. Air is purer for us to breathe.
Tomorrow will never be the same. There's not much for us to proclaim. Now that we have learned so well, nature can renew itself and sustain. Welcome to the brand new world. We're the children of our Mother Earth. Reach out your hands, let us heal our earth together. Welcome to the brand new world. We're the children of our Mother Earth. Reach out your hands, let us heal our earth together.
We will heal the earth, heal the earth, heal the earth. We will heal the earth, heal the earth, heal the earth.
Together we will rise from the ashes to be a strong human race. Together we will find new horizons and wake up to a new rising sun. Welcome to the brand new world. We're the children of our Mother Earth. Reach out your hands, let us heal our earth together. Welcome to the brand new world. We're the children of our Mother Earth. Reach out your hands, let us heal our earth together. Welcome to the brand new world. We're the children of our Mother Earth. Reach out your hands, let us heal our earth together.
Stars, they can tell you stories which are brighter than yesterday. The streets have never been so quiet. The squirrels found a new hideaway.
Tomorrow will never be the same. There is so much hope in our hearts.
Hi, this is Dr. Mickey Mehta, your holistic health guru. 10 commandments for fitness, health, wellness, well-being. Fitness, health, wellness, well-being take you higher on the ladder of evolution. The very purpose of our life is evolution, to add value to this universe. 10 commandments. Commandment number 1. Let wellness be the religion number 1. Religions divide, wellness unites. Wellness integrates, cleanses you, purifies you, revitalizes you, regulates you, and then you can be more devout. Hindu, Muslim, Sikh, Parsi, Christian, Buddhist, whatever. Your devotion will get stronger, more pure. Commandment number 2. Join Dr. Mickey Mehta's Wellness Revolution for a disease-free world. Let 7 billion hearts heal, become whole. Let 7 billion minds have compassion, empathy, sympathy, benevolence, vision, creativity, productivity. Commandment number 3. For strong hands, for strong biceps, uplift the poor. Commandment number 4. For strong shoulders, take the responsibility of the underprivileged. Commandment number 5. For strong legs, be better rooted in humility, to be fruited in humanity. Humility will make you rise. All that bows flies. Commandment number 6. Have a collective vision for a collective growth, for collective harmony, peace, plenty, prosperity for everyone. Commandment number 7. Take pride in collective growth, in collective evolution. Commandment number 8. Sleep every night with a wish to heal yourself. Wake up every morning with a promise to heal the world. Commandment number 9. Meditate to celebrate. Meditate to liberate. Meditate to become whole, to integrate. Meditate to heal. Meditate to feel. And commandment number 10. With all the above, get energized, get naturalized, get maximized, get optimized, get synchronized, get synergized, get internalized, get eternalized, get evolutionized, get revolutionized, get revitalized, get specialized, into wellness and well-being get initialized, all negativity gets neutralized to get Mickey-mized. Thank you. Good luck. Goodbye. I love you all. God bless you all.
Get maximized your get optimized your get naturalized, exercise, let your life get Mickey-mized, 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 Mickey-mized.
you stories which are brighter than yesterday. The streets have never been so quiet. The squirrels found a new hideaway.
Tomorrow will never be the same. There is so much hope in our hearts.
Stories which are brighter than yesterday. The streets have never been so quiet. The squirrels found a new hideaway.
Tomorrow will never be the same. There is so much hope in our hearts. Brick by brick, we shall overcome and walk right into a new start.
Welcome to the brand new world. We're the children of our Mother Earth. Reach out your hands, let us see our earth together. Welcome to the brand new world. We're the children of our Mother Earth. Reach out your hands, let us see our earth together.
Heal the earth, heal the earth, heal the earth. We will heal the earth, heal the earth, heal the earth.
Birds are flying strong and fearless. Green is greener in shrubs and trees. The skies have never been so clear. Air is purer for us to breathe.
Tomorrow will never be the same. There's not much for us to proclaim. Now that we have learned so well, nature can renew itself and sustain.
Welcome to the brand new world. We're the children of our Mother Earth. Reach out your hands, let us see our earth together. Welcome to the brand new world. We're the children of our Mother Earth. Reach out your hands, let us see our earth together.
Heal the earth, heal the earth, heal the earth. We will heal the earth, heal the earth, heal the earth.
Together we will rise from the ashes to be a strong human race. Together we will find new horizons and wake up to a new rising sun. Welcome to the brand new world. We're the children of our Mother Earth. Reach out your hands, let us heal our earth together. Welcome to the brand new world. We're the children of our Mother Earth. Reach out your hands, let us heal our earth together. Welcome to the brand new world. We're the children of our Mother Earth. Reach out your hands, let us heal our earth together.
Stories which are brighter than yesterday. The streets have never been so quiet. The squirrels found a new hideaway.
Tomorrow will never be the same. There is so much hope in our hearts.
Hi, this is Dr. Mickey Mehta, your holistic health guru. 10 commandments for fitness, health, wellness, well-being. Fitness, health, wellness, well-being take you higher on the ladder of evolution. The very purpose of our life is evolution, to add value to this universe. 10 commandments. Commandment number 1. Let wellness be the religion number 1. Hi, this is Dr. Mickey Mehta. Religions divide, wellness unites. Wellness integrates, cleanses you, purifies you, revitalizes you, regulates you, and then you can be more devout. Hindu, Muslim, Sikh, Parsi, Christian, Buddhist, whatever. Your devotion will get stronger, more pure. Commandment number 2. Join Dr. Mickey Mehta's wellness revolution for a disease-free world. Let 7 billion hearts heal, become whole. Let 7 billion minds have compassion, empathy, sympathy, benevolence, vision, creativity, productivity. Commandment number 3. For strong hands, for strong biceps, uplift the poor. Commandment number 4. For strong shoulders, take the responsibility of the underprivileged. Commandment number 5. For strong legs, be better rooted in humility, to be fruited in humanity. Humility will make you rise. All that bows flies. Commandment number 6. Have a collective vision for a collective growth, for collective harmony, peace, plenty, prosperity for everyone. Commandment number 7. Take pride in collective growth, in collective evolution. Commandment number 8. Sleep every night with a wish to heal yourself. Wake up every morning with a promise to heal the world. Commandment number 9. Meditate to celebrate. Meditate to liberate. Meditate to become whole, to integrate. Meditate to heal. Meditate to feel. And commandment number 10. With all the above, get energized, get naturalized, get maximized, get optimized, get synchronized, get synergized, get internalized, get eternalized, get evolutionized, get revolutionized, get revitalized, get specialized, into wellness and well-being get initialized, all negativity gets neutralized to get Mickey-mized. Thank you Good luck. Goodbye. I love you all. God bless you all.
Maximize your get optimized your naturalize, exercise, let your life get Mickey Mized, Mickey Mized, Mickey Mized, Mickey Mized.
Stories which are brighter than yesterday. The streets have never been so quiet. The squirrels found a new hideaway.
Tomorrow will never be the same. There is so much hope in our hearts.
Stories which are brighter than yesterday. The streets have never been so quiet. The squirrels found a new hideaway.
Tomorrow will never be the same. There is so much hope in our hearts. Brick by brick, we shall overcome and walk right into a new start.
Welcome to the brand new world. We're the children of our Mother Earth. Reach out your hands, let us see our earth together. Welcome to the brand new world. We're the children of our Mother Earth. Reach out your hands, let us see our earth together.
Heal the earth, heal the earth, heal the earth. We will heal the earth, heal the earth, heal the earth.
Birds are flying strong and fearless. Green is greener in shrubs and trees. The skies have never been so clear. Air is purer for us to breathe.
Tomorrow will never be the same. There's not much for us to proclaim. Now that we have learned so well, nature can renew itself and sustain.
Welcome to the brand new world. We're the children of our Mother Earth. Reach out your hands, let us see our earth together. Welcome to the brand new world. We're the children of our Mother Earth. Reach out your hands, let us see our earth together.
yesterday. The streets have never been so quiet. The squirrels found a new hideaway.
Tomorrow will never be the same. There is so much hope in our hearts.
Hi, this is Dr. Mickey Mehta, your holistic health guru. 10 commandments for fitness, health, wellness, well-being. Fitness, health, wellness, well-being take you higher on the ladder of evolution. The very purpose of our life is evolution, to add value to this universe. 10 commandments. Commandment number 1. Let wellness be the religion number 1. Religions divide, wellness unites.
10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
And namaste and a global welcome to Healing Our Earth again today on Sunday, the 10th of January, 2021. A very happy new year to everyone. We've already had a Healing Our Earth last week where it was still the festive season with lots of entertainment. And now again on the 10th of January, we continue. And those you may know, it is actually our 56th session of Healing Our Earth. So a warm welcome to everyone. You may be new, you may be joining every week. Do share with everyone. You may be watching on replay or watching it live. Please do go to healingourearth.com, to Facebook, to YouTube, and even our partner channels to see this program being broadcast to you. So before we start, as we always do, invoking the higher, invoking that wellness, and through that, an ancient Sanskrit prayer of Sarve Bhavantu Sukhinaha. May all beings be healthy and happy. Please join me if you can, especially in these times. Maybe pray for the well-being of everyone all around the world. May they be healthy, happy, and may you at home watching also invoke that happiness and health within you so you can serve the others around you. Om Sarve Bhavantu Sukhinaha Sarve Santu Niramaya Sarve Bhadrani Pashyantu Ma Kaschit Dukha Bhag Bhavet. Om Shanti Shanti Shanti. May all beings be healthy, may all beings be happy, and may none suffer. So again, a warm welcome. Today, the whole theme is what other topic, but of course on COVID, coronavirus. But rather than any misinformation, so much information going around, we have 4 excellent speakers on this theme, on how to cope with corona, what is corona, how to cope with stress, the vaccine, all the questions you have. Do not go anywhere and stay put for the next 4 hours with some really good tips and topics, and not in some technical language. Sometimes there will be some technical themes so we can give you the right information, but hopefully coming to you home in a nice way. So with that, a warm welcome to all of our guests who are going to be coming. Do log online to all of our 4 guests. In a moment, we're going to be having Dr. Ajay Gupta with us, later on Dr. Nora Vyas, and you'll see all of our other guests with us as well. So with that, would like to welcome our first guest, Dr. Ajay Gupta. So in a moment, I'm just going to introduce him as well and say that I wanted to share with you, this has been a time, especially if you live in England or elsewhere, that the vaccines have started. Introducing myself, Dr. Milind Shah, I've been hosting a few times and working. So I've come straight out of the vaccinating clinics. You can see here's a vial of one of the vaccines, which is just finished. There's one of them, there'll be a debate again. This is, I don't know, it's not focusing there. I'll have to get a better camera. But anyway, that's the AstraZeneca vial. Here's one from Pfizer. So just finished vaccinating with this. But anyway, we'll be telling you who will be vaccinated first and what the orders are, etc. Some of you may be thinking, when am I going to get vaccinated? Is the vaccine the answer? Or more importantly, is it still practicing the basic principles of washing our hands and keeping social distancing? And more importantly, especially with Healing Our Earth, keeping our minds and spirits calm and sharing that love with others. So on behalf of the directors and producers for Healing Our Earth, bring on 2021. We've been here for you throughout of last year with many, many programs, whether it be for children, entertainment, and may we continue. But without further ado, let us introduce our first guest. So if we can briefly spotlight our guest, really excited to have him on, Dr. Ajay Gupta. Warm welcome and namaste to you.
Namaskar, everyone. Global namaskar to everyone. Thank you, Milan, for your kind introduction.
Great. I'm going to say a few words about you. So I just wanted everyone to see you first, because as I was saying, you're probably the smartest dressed here as well, and very much the most qualified. So without further ado, Dr. Ajay Gupta is in fact a cardiovascular consultant in cardiovascular. So this is heart disease, various different cardiac diseases. And he's also an epidemiologist, which means studying the whole incidence of cardiac and heart disease in different age groups, with a particular interest, obviously, in the South Asian community, based at Queen Mary's Hospital, Queen Mary's University, as well as the Barts Hospital as well. So he graduated with an MBBS in distinction and completed his core training at Delhi University. After that, Ajay won a very prestigious scholarship to come and achieve an MSc, a Master of Science, at the London School of Hygiene and Tropical Medicine. Since then, he's been involved in many clinical trials. How do drugs, how do other interventions get tested by very clever people like Ajay, who are thinking behind how to get a trial going, how to look at the bigger picture. So Dr. Gupta works with patients. You'll see patients in clinic, but also works behind the scenes to guide those of us who are frontline doctors in actually what are the best treatments, etc. I think we're soon to be joined by Sunil Gupta as well. So Sunil, I can see you've just joined us a bit later on, might get you on board as well. So warm welcome to you, Sunil. Another one of our new hosts as well for Healing Our Earth. But with that, Ajay, I know you've prepared a presentation for us, and you've got I think some key questions as well. So maybe, and we can interact together. You're with us for the next hour. So a warm welcome to you.
Thank you, Evelyn. Let me just share a few slides. As you rightly said, I have prepared a few questions which have been asked while working in a COVID pandemic, and also in research setting, looking after my patients as well as my relatives. So this is my introduction, which Milan has kindly provided. And this is what the aim of this next half an hour is going to be. Very much expect Milan to ask several questions in between, as well as the public to send the questions and answers so that we can address those. What I'm going to do is just discuss upon a few aspects of which are probably more interesting, or more you might know, but you may not know the basis of those things. So I'm just going to give some facts and recommendations which are commonly which we everywhere in the media is available. What I'm going to talk about is tell you basically what is the coronavirus disease, which you may know, what are the symptoms, and we will talk about how you can prevent this disease or protect yourself as well and your family members. About what to do if someone in your family or yourself have a COVID. So these are the things, and these are based on the facts as well as the evidence. So, so while you know the basic, but you may not know what is behind it. And then we will talk about some basically about what are the treatment available, so that you are aware if someone in goes to hospital, what is going to happen to them. But we are not going to go in details about it, just so that you have some idea what is happening on them. And then we may just touch about vaccine. I know there's a huge session about vaccine later, but this is an important question everyone is asking. So let's go about it and have a chat with this. So Milan, please do interrupt me if there are things I'm becoming more complicated. Please do let me know about it. And just so we can start with this, last year around December, January, I was in holidays, and I was as an epidemiologist. I also keep a watch on there's a global network of epidemiologists, and there's an outbreak disease network which many of the epidemiologists cater to. So anything new happening, it comes onto that network. And there was some reports coming in December that there is a new kind of a disease. And even new different presentations, people start looking at it. The way the flu surveillance happens is anytime, is especially after the SARS in 2003. If those things happens, doctors, researchers take the samples, do a genomics analysis, and see if that virus or that bug is different than before or it's same. So that's what they started doing, and we realized there's a new disease emerging. So at that point of time, and you might be confused, at that time it was called as 2019 novel coronavirus. So let me just clarify. Coronavirus has been there for a long time. There are different kind of coronavirus, and this was because it was found in 2019. It was initially named as 2019 novel coronavirus. Afterwards, WHO in February gave it a better name, which is SARS-CoV-2, and you might just, I think, it is basically a short form of severe acute respiratory, means chest syndrome, coronavirus 2, because there was a SARS-1 in 2003. So it's a SARS-CoV-2 you might come across. And what we call it, this disease, which this virus caused, is coronavirus disease 2019. And in shortened form of this has now become COVID-19. So just to understand that COVID-19, when we think COVID-19, it's basically a coronavirus disease of 2019. So, this is what yesterday I checked how many people in the world have a coronavirus disease. And these are known people who have been found as positive patients. So there are about 88 million people who had a coronavirus tested and confirmed, and about less than 2 million have died because of that, and unfortunate that way. But if you remember the numbers, you are talking about, I will just take bigger numbers, let's say 90 million and a 2 million deaths. So you are talking about every 45 patients who have tested one death. So it's a severe disease. It's not a trivial disease. And it's very important that we need to understand what is the what we can do to prevent that risk. 1 in 45, if I were to say that is a death risk of a death, then everyone will be concerned. It's not a simple flu. So this disease goes to it gets to other person. So for example, if this person is having a disease, it's called this virus is there. This virus is comes out of your body through your secretions from throat or nose, and while you are talking, you are coughing or sneezing. And that's where the basic things you need to understand. So if a person is not affected or is susceptible, so this virus has to go through their eyes, nose, or throat or mouth to make them a disease. It can happen because infected person has just coughed, so and the droplets remain, and these droplets are normally more than 5 micrometers, so they can travel a distance of about 1 to 2 meters, about 1 meter. Sometimes they are very small particles. It can remain in the air suspended, so that can be a sign. But most commonly it's because of droplets, and these droplets can also be go into a surface. For example, they are coughing or they are talking loudly, there are few secretions gone into your desk, and someone else comes and puts his hand and there's a dust. So we call it as fomite. So this is how the transfer happens. So if I'm, for example, you and me are not affected, I will only become a disease if I get fomite through a transfer. So if I put my hand here and then put that hand in my hand on eyes, that's why it's important to do hand washing. If I were to talking to that person, if they are talking and I'm not covered my mouth or he's not covered his mouth, then these droplets can come directly or they can be suspended in the air. So this is why we all call for these 3 important measures. And I'm going to go down about the reasons and the evidence behind them. Other thing which is important to understand is, how do you know you have a coronavirus? If there are common symptoms. So if a person is exposed to a coronavirus, they start developing symptoms between 2 to 14 days. So it's variable. It doesn't mean that you will develop in next few days, you don't develop. You can develop as much as 14 days. Its symptoms can be varied. There are some common symptoms, but there are different things can happen. So, some people may have headaches, some people have a runny nose, sore throat. People may have loss of smell. They may have a loss of taste. Cough is very important. Some people have a fatigue, malaise, means muscle aches and laziness, lethargy, feeling chills, they are feeling cold, sweaty. Sometimes they may be short of breath, and sometimes they may have nausea, vomiting, or diarrhea. So, but the common symptoms are commonly which we come across is fever, high-grade fever, for sustained fever, dry cough, and loss of smell and taste. Others are a bit less uncommon, but they can happen, including diarrhea, which I mentioned, and rashes sometimes. So these are the symptoms you should be aware about. I hope everyone is clear about it. Milan, you have any questions about so far, or we can go ahead?
No, it's been going very good. So to summarize, you've really given us already the background of COVID, because that's been a question sometimes, people not knowing what either COVID stands for or what the virus is, etc. And also telling us about the symptoms and where it's spread. I didn't realize that it's actually now around 1 in 45 fatalities if you look at it globally at the moment. And sometimes people may say, I've caught COVID, when sometimes what they really mean is they've been infected by the virus, and then they may give some symptoms of this. But as you also say, is that sometimes people may not have any symptoms for a while. So, they may have actually be carriers of coronavirus, but actually not know that they are carriers at the time.
Absolutely, Milan. So I hope you have got some understanding about it. So let's move on to a few things. Few things which are very, very important for, because you might come across your friends, family members, or other distant relatives and all, and they may have a coronavirus infection, and they may start developing some symptoms. You might be asking them, there are certain red flags. You should all be aware about them. If a person, because most of these patients, do not require hospitalization, they will be at home. They will be under supervision of people like, for example, Milan's surgery. There will be hundreds of them, and a person needs to be aware, or their relatives needs to be aware when need to call up emergency or doctors seriously about it. When you are having shortness of breath, or difficulty in breathing, or maybe unable to complete the whole sentence. You are speaking, but you say, oh, I feel out of breath when I speak of one sentence. Sometimes you might have a weakness of a loss of speech, mobility. Chest pain is very important. Sudden chest pain, which is increasing on taking deep breaths, is an important feature which should not be ignored if you have a COVID infection. So these are the serious functions. But I must reiterate that most of the people, it is a disease which is going to be very mild. So if I were to give 100 people the coronavirus, only of them, definitely 80 to 85 is not going to be anything but normal, mild, or asymptomatic, mostly mild infections. Of those 15 which are more than mild, 5 may or may not require hospitalization, other 10 will require hospitalization, and of those 10, about 33% might need ITU. So overall, we are talking about out of 100, you are talking about 10 and 15 people requiring hospitalizations. So chances, if you have a coronavirus or your family member have a coronavirus, chances are they will be fine. You just need to wait and watch and look at certain things, and look at further dangerous signs. So that is what, then the question is, how can I protect myself or my family? That is an important thing, which we probably need to understand. And this is what has been clearly mentioned by loads of people, where face covering face, which is people keep on speaking about physical distancing, hand washing, and I explained it to you earlier why that is important, because that prevents the infection to come to you. So it is very important in case of face coverings are very important, especially for when you are in a close environment, especially when you are caring for the elderly, because you can't put a distance behind, or you are traveling around, you are then you cannot put a distance. So in those circumstances, if both are wearing face coverings, for example, when I go to the hospitals, I'm wearing a face covering, and some of the patients who are able to can wear face covering, and it becomes a better things. But face coverings are very important in certain situations. So important. But why we are saying this? This is very important, and this is technical. I'm so sorry. I just want to use the technical things just to say that they are not mere words. They are important science behind them. You might just say safe distancing, but there is 172 studies which have investigated this. And when we combine data, we got this kind of graph. Let me explain this kind of graph. So this is absolute risk. So for example, your risk increases if you are in close contacts. And I suppose you are in a contact and this is a distance away from the patient. So if I'm close to a person, now this is not only based on the COVID infection, but this is based on the other infections which behave like COVID. For example, the old SARS infection of 2003 or MERS infection, which are all coronavirus. So they have every virus, and there's another important aspect to understand: mutations, which you will come to understand. I will explain it to you later. So every virus has a transmission level. So some viruses are less infective, some are more infective. So if I were to grade them, that this blue line is people who are having an infection which is more infective, whereas if I were to say green line is the very less infection. If you look at, and this is a red line is a moderate infection. So if you have these people with this kind of infection, if you are closer than 1 meter with them, you can see that you have a significant amount of risk. But as soon as your distance increases with them, your risks start going down. So it's that's why the government used a 2 meter distance, because by the time it's 2 meters, especially for moderate infection and the low infection, its risk is very minimal. Now, here's the catch. With the new mutation, which is more infectious as compared to before one, it might be this one. So while government is persisting on 2 meters, I would suggest that it might be that more risk. If you do a more distance, you will be much more protected, and because this is how the line goes. If you are on 3 meters, for especially high risk infectious, more distance might be better. So minimum of 2 meters is for the new mutant, definitely, but probably try to do over 3 meters. This is what evidence is suggesting. I hope it is clear for everyone the behind. Milan, is it technical? You want to make a comment on that?
No, this is good. As I said, I knew that we've got an epidemiologist. We have to show a graph, but no, it's excellent. It's very clear. This is straightforward. So we can see, look, the closer you get to someone, you can see immediately this absolute risk is going really high, and the further away you get, because there was some debate certainly earlier on. We're saying, where did this 2 meters come from, and so on, and there were, understandably, people's freedom doesn't want to be curtailed, and so on. But I think this is very clear that maintaining at least that sort of 1 to 2 meters at a minimum clearly makes a difference. And we've seen that in real life. As a frontline clinician, I can see that usually now would be our high flu rates, and we can see flus and other illnesses are down, maybe because COVID is raging, but so some benefits have happened from the social distancing.
Absolutely, Glenn. So moving on to the other aspects. So the other one was, what about enclosed and closed? Why can't I call my friends at home? Let me just tell you why you can't. So there have been a few studies where people have looked at the cluster of infections of COVID positive infection. In fact, right word is SARS-CoV-2 infection, but let's go for a normal lingo of COVID. So we looked into that, and what we found was that if a person's primary contact, if a person who is infected is in the indoors, and you have a contact in indoor space, you are 18 times more, or close to 19 times more likely to have an infection with COVID as compared to if you had same contact in open air. So make your choice. Do you want your risk to increase by 19 times? That's what it is. Then other aspect is there. They have looked into super spreading, like a one person spreading infection to many others. And what we found is, whenever we have looked into super spreading events, most of them, 6 out of 7 events in those studies were in indoors, causing a 32 times more increase. So that's why the direction which have come to you guys, that please do not meet with people who are not in your close contact daily. Do a bubble indoors, because that's where you are more likely to have enhanced risk. And similar studies have been done in Germany, where the indoor work meetings where those there. Obviously, in France, there was a ski chalet, huge big cluster, and the initial clusters from South Korea, from which came from churches. So there are huge evidence about indoors and outdoors, and good science behind why you should have a good ventilation in your rooms. And then there was a skepticism. I know we are lucky in UK that the skepticism of a face covering is not that much. But fact is that our governments took a long time to ask for the face covering, and still is not making it mandatory, while our mayor here in London yesterday said that face covering, you should do it outdoors anyways. So let me just tell you what the data is. Data is, again, there have been several studies in a long time, not big studies, small studies, but we have collected the data. When we collate the data from different studies, we call it meta-analysis. So basically, it's combining all the data together and making a kind of a summary of those studies. And what we find is that use of face mask can reduce your risk by 85%. And if I were to say that I will be 85% less risk at infection of developing COVID, I'm going to wear that. And I hope everyone does understand that logic about it. And the other important thing is, persons who are wearing the face masks. So this is a study where they did for not for COVID only. There are acute respiratory infections where the infection goes through droplets to others. So they asked if you wear the face mask and face coverings, what happens in your external environment, when can we detect the virus? So what they found was, in a normal circumstances, even if they are talking, it's not sneezing and coughing we are talking about, we are talking about, we can find the evidence of respiratory virus in 3 out of 10 samples in those who are not wearing the face mask. But if we were to wear the face mask and we are infected, we will not find in none was found evidence in 11 samples. So you can see that how much reduction of risk is there to others when you are wearing the face mask. Same thing which we, because I told you, one is droplet, but sometimes there are small particles which suspends in the air, which are not visible, and that's called aerosols. And we found that wearing this face mask reduces the risk to 0 of 11 as compared to 4 of 10 if you are wearing the face mask. So it's very important to protect yourself and protect others. That face mask and face covering should be done. And that's where I would say this is where the evidence leads us to. So important is, if you have you want to protect yourself and your family, you as soon as you are symptomatic with those symptoms, you should be quickly realize that you have an infection, or maybe have a particular infection. Get yourself isolated, get yourself tested, quarantine, wash your hands. Everyone in the family should be washing hands, maintain social distance, wear facial coverings, and obviously there are disinfect. Now there's some questions about what is the best way of disinfection of these viruses. So what people have done is they've taken the viruses and see which are the compound agents, chemicals, which can disinfect them rapidly. So all these viruses. So alcohol is very good, between 62% to 71% concentration. It's perfect. So you can use that, alcohol gels and all. But there are other agents also, which are probably sometimes cheaper or easily available, especially for house or area disinfectant. So you can have this agent called hydrogen peroxide or sodium hypochlorite. They can be very effective agents. But there are few others in the market which previously we used to use it, and we still use it. For example, chlorhexidine or benzalkonium chloride. These are the agents which are less effective for a virus. So you need to make sure that you are using the right agent to disinfect your surfaces. Coming to surfaces, let me just explain to you the science behind those surfaces. This is what the science is. So what this study's done was they looked at the duration of a virus or the particles in different environments and surfaces, how much they are viable or they can be viable. But again, this is laboratory test. We it in a real world, maybe slight difference. It will be less in real world, not longer. But this is what we are talking about. So, but this is a ballpark picture which we are saying. So, if a person has generated aerosol, that virus can be suspended up to 2 or 3 hours in that area, but that normally that content is very low, and if there's a ventilation going on, this will disappear. So it's not that bad. That is only bad for people like us or million healthcare professional, where we are in close contact with the patient. So aerosol for general public, you do not have to bother. But for other surfaces, for example, cardboard, the level or paper, the virus can live for about 1 day or up to 24 hours, whereas a stainless steel or a plastic, it can live for more hours. So this is what more hours you can see, and this is the kind of time where they can find the virus. If you can see that this is where the concentration is. This is a concentration. So acutely there will be more, but they can find a small concentration up to 3 days. So this is where what is the logic of cleaning the surfaces, but also what kind of surfaces you need to be very careful about. And then there's a question which my aunt asked me the other day: how do I do about my food safety? I think that is why I brought this slide. That important thing is always, and it's been ages. We always been saying to my as a child, I was told that before eating I should wash my hands, and that's what is the basic logic. Every time you wash your hands, so it's important that you are washing your hands because that with soap and water it eliminates the virus. Other things are, obviously we talked about surfaces, so you need to be make sure that those surfaces you clean it up regularly where you are eating and drinking, and if you are buying the groceries, probably it's a good idea to throw away the disposable bags, or use do not use those disposable bags for at least 24 hours, but maybe up to 3 days. Wash your hands as soon as you touch them. You always disinfect your countertops. But food is anyways as wrapped. For food which comes unwrapped, you can wash them, and washing is perfectly okay with them. So that's what I think is a way we can protect ourselves and our family. So Milan, is there any questions so far?
No, this is great. So we've covered sort of social distancing, we've covered symptoms as well, and then more recently the face covering, which I think was a big topic, and that sort of came in the last few months. I think certainly around the world that's now been accepted. As you say, there's certain countries where it was really going against their liberties or whatever. But I think the key thing was that wear a face mask to necessarily protect others, so you're not spreading it around. And if we all do that, we're protecting each other. And then nicely on the topic of food, you said your aunt had that message. And I think, grocery shopping or so on, it's a big fear. I mean, it's a bit, being a primary care practitioner, I look after a lot of elderly who have not been out of the house, trying to work out some of their basic grocery shopping. Some can have people helping them. Others sometimes have to venture out, but to do so in the safest possible way. I think you've explained everything very nicely. And again, in previous Healing Our Earth sessions, we've had topics on diet and things to actually boost your immune system, etc. So that we've at some point covered all aspects of protection. And today you've really covered us nicely. So I think let's carry on now with this theme of what do you do?
A very quick question, Milan and Ajay, if that's okay. Sunil here.
Welcome, Sunil. Welcome to
Hi, Ajay. How are you doing? Okay. Lovely. Just to actually ask you, do you recommend that we should try not to use the escalators, the lifts actually in the buildings? Since the COVID outbreak, I have actually stopped using lifts in my hospital because of obvious reason. Another thing is that what is your recommendation about the letters, the post which we get? Because you mentioned about the paper and cardboard, it actually stays for about a day. So would you recommend that we actually should not actually touch our letters or touch the letters with a glove and just let it be there for about a day before opening it?
I think it's a nice question, Sunil. It's very important. So let me just tell you about science and practicability, because science and what is feasible should match together. Now, as I said, science, the levels can stay for up to days, but you also needs to look at the probability. So how much is the probability that this will be infected? How much is the probability on that one? But also important fact you need to understand is that infection is only going to get infection is if you touch that, do not wash hand and then eat before washing hands. So you touch it, do not wash hand, you then eat or put it in the eyes and nose. So it's up to your choice. So you can leave the letter for a day or 3 days. It's up to your choice. But if you want to open it that time, you can still open it up. You open it up, you wash your hands immediately. Make sure that you do not touch your face, eyes, and make sure that that is a habit. So then it's okay as well, because it's an outer covering which is going to be the main issue. So you if you open your letter, discard the outer covering in a safe place which is not touched by others, and take it out and then wash the hands and then take it out. Internal letter, again wash the hands, and that should be okay. So it's a your choice, but there are choices you have. You have a choice based on science that you leave it for 3 days, at least 1 day, or you can use it immediately, but with proper precautions.
And the one more question about, try to kind of get rid of the virus. Suppose it has actually stuck to your upper respiratory tract. A lot of people actually, since the COVID outbreak, they haven't actually drinking a lot of hot fluids first thing in the morning and last thing in the night. Do you have any evidence behind it that if you actually drink more hot and hot water or hot liquids, will that actually help in getting rid of it or scraping it off the respiratory tract?
It's a good question. Many people ask it. So let me
just to interject 1 second, Ajay, if you could stop your screen share for a second, because these are really, really good questions. And at the moment, I think we can just see your screen. We'd love to see your face, and that's great. Good. And we'll bring Sunil in as well. Sunil, you've been using the escalators and the stairs, and that. So if nothing else, I'm sure you've got fitter.
Yeah, a brilliant question, Sunil. So I think the important aspect is, sorry, you wanted me to answer the escalator one, or there were later one about the gargles and steams. So let me just come first about gargles and steams. There's no real evidence in where if you do a hot water, drink lots of hot water, or do a gargles with that, your infection will be less. It does help in symptoms. If you are symptomatic and you are doing those things, it will be making you feel better. But as a preventive step, there's no evidence about it. There's a 1 or 2 studies which are not high quality studies, and they have not shown any benefits in itself. But again, different stroke for different folks. They will not do any harm either. So if you want to do it, do it. But I will, as a doctor or epidemiologist, will not recommend it because there's no evidence behind it.
Fantastic. Just one last question, actually, on the same thing, not on the same thing, but a slightly different, more scientific aspect of COVID and the ACE receptors, because there has been a lot of talk about people, especially the Asian people or anybody who's the ACE inhibitors are the most commonly used antihypertensives, and there was a notion that those folks who are on ACE inhibitors are more likely to catch infection, or it could be more virulent. Do we have any evidence behind it so that we can quash this kind of a myth amongst the people who are taking ACE inhibitors as antihypertensive? Thank you.
Brilliant. I think that's an important question. I've worked personally on this a lot. Did a white paper way back in April, first of the white paper in for these cardiovascular disease and coronavirus. Now the fact is, you're right. The virus enters through something called ACE2 receptors. Now, there was an initial fears that people who are taking these medications may become more ill or may have a more risk of infection. Subsequent analysis have shown, in fact, on the contrary, that there's a possibility that if you are still on ACE receptors and you develop a disease, you may not have a severity of that disease. And definitely there's no increased severity, but you may have a bit protection. So the evidence of if I just want to reassure all people with high blood pressures or heart failure patients who are on these medications, they are safe. They are not making you more sicker if you develop this disease. In fact, if at all, the evidence is pointing that it will be protective to you. So it is, you should continue on those medications. So,
Great. So just to interject, those who are watching at home, so these drugs, as you may be, so they often end with the word pril. So this may be ramipril or enalapril. So you're spot on. Initially I had patients coming saying, "Doctor, shall I come off this drug immediately?" And some even did. This was back certainly in April, May, and certainly you had risks of your own actual condition getting worse rather than actually any problems with corona. And it's really interesting to hear that, in fact, it may even be slightly protective, certainly not causing any problems. But yeah, those are at home. These are usually drugs called enalapril, or there are other ones as well, but those are the two common ones. But back to you.
Brilliant, Milan. So, is there any other questions, or should we move on to a bit? I know our time is there. I just want to show them a few things before we go into a question answer sections, and there may be other questions also.
Yeah, definitely. No, this is where we're very excited. We're plastic. We're enjoying. We're having a three-way conversation. So good. Welcome to Sunil as well. So while Ajay, you're just getting your slides up, I think we're nearly ready. But do those of you who heard the other voice there and seen a picture of Sunil Gupta, who's another one of our co-hosts here at Healing Our Earth. So warm welcome to you, Sunil. Thanks for joining us as well. And Sunil is a hemato-oncologist, so locally here at Lewisham and Greenwich Trust as well. So very much in the medical field. And we'll say a bit more about you, Sunil, as well in a moment. But thank you for really enjoying like a three-way conversation here.
Thank you.
Milan, thank you. And so it's always good to have interjections and important things. So we will talk about a bit about what to do if you have an infection or your family member have an infection. I think these are the 10 commandments you need to know. One is stay home. Stay home, not only that you will infect others, but stay home because this infection can have a long-term effect on you. You need all the rest. You need all the rest. You need all the hydration. So this comes to the point 3. So stay home, rest, keep yourself well hydrated. You should always monitor your symptoms. I tell my patients, and in fact, my relatives in India who have developed the things, keep the symptom diary. You need to say, okay, I was unwell, maybe in grade 1, 0 to 10, I was having lethargy number 4 of 10, 5 or 6. It gives you an idea about what your disease is doing. It's worsening or improving. So it's good to have that kind of symptoms, a diary if you can keep. Always, if you are living alone, or even if you are not living alone, inform your healthcare provider, because they should be aware about that you are having infection, but you are at home. That's okay. You do not need them, but they should be aware. But also important that someone else is aware, so that when you are not able to take care of yourself or you are becoming unwell, they can put a cry for help. So it's important that these things are there. We already discussed the red flag symptoms when you should be worried about things. Like I told you earlier, and we'll come again and again about it because these are important things. Shortness of breath, if you are feeling any not able to speak, or chest pain, or you are having a blueness in the hands, or a blue tinge, those kind of things are very important to observe as a person yourself with the infection, or as a family member that the other person is not having that, because that is the indication you need immediate help. So this is important things. Again, important thing which we have already discussed about importance of covering your face, washing your hands. Important other aspect is stay in a specific room, and if possible, use a separate toilet. The reason why you need to use a separate toilet is it may be interesting, and many people will not know. While we are always concerned about that a virus is coming through secretions, respiratory secretions, but the longest this virus comes from is through your fecal-oral things. So your gut also has the viruses, and when you pass your open your bowels, you also have the viruses. So that's why it's very important that you use a separate toilet. If not, then after use the toilet that should be disinfected so that other people can use it. So, and avoid sharing personal things in that setting, including dishes, towels, and definitely clean all surfaces as we discussed. So, as a family member, I would say these are the things which we discussed. Wash your hands, and definitely before preparing, after preparing food, before eating, and whenever you care for a person, you go there with washed hands. When you have talked about it and you come out, you wash your hands. Important is always keep both of the, if you have to come close, a face covering should be there. And monitor people who are well, they should also be monitored for symptoms, because you never know that they can develop infections or symptoms. So you need to monitor them carefully. And self-isolation things, if you are in a room, you are already in a room, important is ventilation. So you think about a ventilation of that room, because as I told you earlier, in closed space, the virus infection chances are increased by 18 times, or and super spreader increases by 32 times. So you want to keep this aerated, because your family members might enter for a period of time, and you don't want them to asymptomatic people to get infection. So keep it aerated. Definitely no one outside your bubble should visit your home, and try to reduce the your waste which you have to dispose it in a safe way, so that your other people who are coming in should not come in contact with your waste. So these are the important things about self isolation. So just to overview about it, if you are caring for someone else, make sure that they are taking a good rest, taking lots of water. Sometimes their appetite goes down, and Milan can tell you about many things which they ask they are not able to eat. But it's important that you increase your carbohydrates intake. So you can use the things like protein shakes or smoothies, whatever. You increase that. Common symptoms, paracetamol is enough for fever. That's good enough, or you don't need any other medication mostly. And you keep a watch about the red flags which we discussed. And to protect yourself if you are caring for someone else. We talked about those things about covering face, washing, and obviously as a carers, you also need to quarantine. So that's another important aspect, because you can yourself develop an infection up to 14 days of that contact. So it's important that these are the things you understand, practice if you're caring for someone, or looking at this. And this is again the list of red flag symptoms which we are talking about. Sudden worsening of breathing or shortness of breath, which is new. We talk about chest pain. If the chest pain is happening, that is a red flag symptom. You need to talk to your medical emergency or a physician. If you're feeling you are not able to speak one sentence properly because of shortness of breath, that's a bad sign. Obviously, you need a medical attention. Blueness of tingings of lips or face, or confusion, or becoming extreme lethargy. So here the things can be about symptom score. So if you're thinking, oh, last few days back I was only lethargic, my self score was up to 5, now it become 9 or 8, that again is a sign of progression and you need help. That's where it is. So Milan, anything you want to add here? Any questions so far?
No, fantastic. I think once we finish the presentation, we can talk on, but it's a really key topic, I think, about looking after loved ones as well at this time, and some of the key things, and sometimes myths can go around, but I think this is very systematic. And I think the key thing is keeping in isolation at that time, and practicing good hygiene, and helping boost their immunity as best they can. Lots of things are obviously said, take this or take that, take ginger, take this, but generally good, healthy, good food and fluids. Appetite can go down. So I've looked after quite a few of my patients with COVID, and one common theme is that the appetite and the taste of sense and smell can go down. But I liked your point also about monitoring of symptoms. I think it's really important. Just keeping even a simple A4 sheet or on your phone or whatever, day 1, day 2, it can come really handy when you're speaking to a healthcare professional in the future, that we know roughly where they are. It's a really good tip. Thank you for sharing that.
Thank you, Milan. So just next few minutes, I just want to wrap this up. So I just want to give you an overview of what really happens if you are in a hospital or when you are going to take treatment. What is the treatment recommendations are? So because I'm a clinical pharmacologist also, which probably I should have told you earlier also. So these are the medications which we are looking at. There are around 323 different treatment strategies currently being investigated for COVID. And these can be divided into 7 categories. There are antibodies. Common antibodies is artificial antibodies, which we are giving synthetic, for example, which President Trump received when he was day 1 with no symptoms and infection. There are antivirals, which some people may know about, remdesivir. And there are certain cell-based therapies which are promising, but other things are more of experimental as yet. And just to understand why we give up when we are giving the disease. So in a whole, we can divide our disease into 3 stages: stage 1, stage 2, and stage 3. So in a stage 1 is the most people, 80% of the people are going to be stage 1, where you may have a virus playing up with your system. It's a virus inside. We call it a virus response phase, where you might have a fever, dry cough, some symptoms, and in this stage, actually nothing helps as far as the evidence is concerned, except for our antibodies, which only I think are available in America. So these are the certain antibodies treatments which people are given in outpatient setting if they have mild infections. They do prevent the progression of disease. But having said that, majority of people who are in a community do not have that progression over the period of time. But there's less chance of that progression. But the second phase, where disease start become more severe, is when people start developing shortness of breath and their low oxygen, and that's where the virus is affecting their lungs. And that when their body is starting a hyperinflammation phase, and at that stage we give some antiviral drugs called remdesivir. And if our oxygen starts going down, we give us steroids called dexamethasone or something like that, and sometimes give us oxygen. So this is how the journey of a patient who worse goes like. We have these drugs which are proven, which are recommended, and have a proven benefits now. And this is how we doctors use this kind of algorithm. For most of the non-hospitalized patients, a mild to moderate COVID, we don't want any medication. We just want you to take water, drink good hydration, good food, as Milan said, and rest. That's the only thing which we want you to do. Monitor yourself. If you are in America, probably you will be offered one of these antibodies, but other places there's nothing available. If you are in a hospitalized and you do not require oxygen, then some people will just be given observation and injection called remdesivir, and nothing else will be given. And if you are hospitalized and require oxygen, you will given us steroids in addition. So this is how we treat them. Then there's a question about what is plasma therapy? What is plasma therapy? It's an age-old therapy, hundreds of years of evidence which we have. It's basically what we do is we collect blood from people who are recovering from COVID, because they already have the antibodies in their blood. We collect those antibodies and infuse it into people who are developing disease, and then give them antibodies, hoping that it will help them. Evidence, there have been 3 big trials on plasma so far, therapies, and none of those trials have shown benefits. So we believe, although this makes good sense, at this point of time, evidence for this is not existent and still in a clinical trial phase. So this is what a brief overview of medications and other questions are. Milan, do you have any questions about it? You're on mute.
If we could just stop the screen share for a moment, because we always like to see our faces, and then we can come back there. Excellent. So Ajay, you're on a really helpful topic. So a few things from a primary care point of view as well, and a welcome to Nora Vyas as well, who's just joined us as well. So just as we're talking about science, more importantly, I love being a GP because it's also dealing with people and actually what's their mental health going through, what's their journey through this whole illness. So stay tuned, everyone. Don't go anywhere. We'll be covering that aspect of the illness very soon, or the mental health aspects. But Ajay, coming back, a few things on the primary care aspect. So those of you at home, from a primary care point of view, generally we'll just manage you at home. As you say, you start with stage 1 of an illness and may not go any further. One thing that generally, certainly in England, we're also giving is a course of antibiotics. And that is not because we know it's a virus. An antibiotic won't obviously help with the virus, but to help any secondary bacterial infection. So be prepared with that, the primary care guidelines will be with that. I wanted to ask in a moment about vitamin D. Any thoughts on that? Because that's obviously been doing the rounds on various levels. And also on SATS probes. These are oxygen saturation probes in your tips. Certainly in primary care where I work, we actually do a SATS probe delivery service. So we'll actually go and deliver a SATS probe to our patient so we can see what they're doing and remotely assess them. So I want to know if you had any thoughts, maybe starting on the SATS probe.
Excellent questions. Let me just answer all the 3 one by one. So SET probe, I did not mention, but because I don't know whether it's available for everyone or not, but it's a good tool to monitor a person. So as I said, most of the people, what happens with this coronavirus infection is the main infection, this infection can, although we are always concerned about lungs, it can affect many other aspects of your body. It can affect heart, it can affect blood vessels, it can affect GI tract. But most of the mortality or serious effect is because of lung infections, lung inflammation or lung infestation or by this virus. And what over the period of time, what happens is a person start lungs get compromised, and the earliest thing which happens is that you will have pick it up with your oxygen saturation going down. Normally, your oxygen saturation will be 97 to 100%, and we have a tolerance level about 94% with these patients. But if our levels are going below 94% or 93% or lower than that, then we are more concerned about you as a healthcare professional. So this is where SAT probe can help people monitor themselves if they have availability. So they can do 4 times in a day or 3 times in a day their own. It's very easy to do monitoring. They also provide you with the heart rate, because heart rate again is a very good parameter to look into. You are when you are having infection, your heart rate is going to go up. But if it keeps on going up and it doesn't improve and worsening over the period of time, that is also a bad marker. So these are the ways you can find out yourself that if you are not amongst very small number of people who are not progressing towards recovery and going towards the other side, and you need more intervention. So these will be useful for your healthcare providers as well as yourself to know when to seek specialized in treatment or intervention.
Thank you. Yes, definitely, because there are a lot of charities now delivering SATS probes, if possible. Sometimes people get desperate. You go into online and suddenly the price of something has gone high. So I think you're right that some people are desperate to try and get hold of one, and suddenly the price escalates. But it can be a useful monitoring tool. And then that about vitamin D. Certainly in UK, there was a lot of evidence, but a lot of information going around, whether it was just helpful over winter or it had some protective role. And if you had any thoughts on that.
So I did a bit of research in vitamin D in diabetes long time back, but and a good vitamin D fan myself. But unfortunately, so far the evidence in terms of treatment. So there's 2 clinical trials which have just been published, where vitamin D supplementations in the hospitalized patients have not made any difference in outcomes. So vitamin D and per se as a treatment, we do not know it will be useful or not, because at this point of time, there is no evidence. But what we do know that people who have a serious progression of serious events usually have low vitamin D. So that's why we thought it will be useful, but we have not proven as yet that vitamin D supplementation can be if you have a disease. But there's another matter. Another matter is, if you do not have a disease and you are taking vitamin D, whether that can prevent, and there's a good science behind that, it potentially can prevent you having that infection. So there is currently a trial run by one of my colleagues from Queen Mary University of London, which is giving vitamin D or placebo tablets to thousands of people. They are taking daily, and we will know very soon that that vitamin D supplementation prevents your chances of having a infection or not. So right now vitamin D story is still open. What we know is, as a treatment in hospitalized patients, it doesn't work.
Excellent, thank you. And again, introducing Sunil as well. Sunil, if you've got any other questions. There was another one that's been doing the rounds, is ivermectin. As you may know, it's an old anti-parasitic. And again, on WhatsApp, that was doing the rounds, a lot of videos about ivermectin. I don't know if you had any thoughts on that.
Excellent question. I think, look, we as a human beings have always go for hope. It may help and all, but unfortunately, if ivermectin was helpful, it would have been phenomenal. Unfortunately, there's only 2 studies. One was a lopsided study, what we call observational study, which showed possible benefit. The only evidence of ivermectin is in lab-based studies, that in cells it can be in the times which it never reaches the human body. 50 times the more dose, that level, it can kill the virus. But the studies so far are lacking, and evidence is non-existent. This is not in the guidelines. It is still for a clinical trial research.
Excellent, thank you. And we've got, so I mean, it's exciting times. We've got lots of questions going on, so we're really enjoying this topic. But we will be introducing Dr. Nora Vyas soon as well. Another topic came actually, it was on my mind as well. It's come as a question about steroids as well. So we know that, look, towards the end, dexamethasone is still there. In some countries and so on, there are actually prescribing oral steroids at early stages, so oral prednisolone. So those of you who are watching, you may have come across oral prednisolone used for many things, like an asthma flare-up as well. As far as I know, certainly in UK, in our primary care guidelines, we're not usually prescribing oral steroids. We're only sticking to supportive management. So the question was twofold. Number one, is there any evidence of early use of steroids, such as prednisolone, in the community? And then someone has actually said that if people are already on steroids, as you know, people are on maintenance steroids for inflammatory bowel disease, for various conditions, polymyalgia, etc., they seem to be more, their immunity is a bit down. So it's like people are feeling a bit confused that steroids are used to treat it, but it also makes you more susceptible. So I can understand, as a layman, you can get quite confused. Maybe we could just explore that very briefly.
Oh, excellent question, Milan. Very important question. Now, there are 3 different trials because we are using this steroids in a hospitalized patients. And one of the main one was recovery trial, where they used, and I was part of that recovery trial, where we used in hospitalized patients these steroids. What we found was that it is only beneficial in people who have oxygen requirement, or people are in a very high, where they require ventilation. So in a serious disease. And I remember the slide I showed, there are 3 phases of disease. Now in a phase 1, stage 1 disease, where some people are given steroids, the virus is already replicating. It's becoming more and more. At this stage, steroids theoretically should not do benefit. And what we have seen in recovery trial is the truth, that during the people who do not require oxygen, if you give steroids to them, it's harmful. So steroids should not be given in a community setting. It should only be given in hospitalized patients. And by definition of hospitalized patient, they are the people who are requiring oxygen or requiring organ support. Again, I repeat, the evidence clearly and the biology of that is that steroids, extra steroids, over and above, as soon as you become into COVID infection and you are just in a mild phase, should not be given. It can be harmful, more harmful. Okay, so it's at right time. Steroids needs to be given at a right time and right time dose. Does that answer your question, Milan?
For sure, no, that's an important point. So we're sort of coming to the end of our time. We've covered all those questions right from the beginning of what is corona, what was it called, how did it spread, methods of spread, prevention, etc. So we've gone on a nice journey together, and particularly your theme as well of, you are a professor of, a teacher of cardiovascular disease as well. So maybe just an ending point, because obviously there'll be many, many viewers around the world, but particularly this link maybe with our ethnic minority groups or the BMA with COVID, also with cardiovascular disease, maybe just sharing one final point on that theme.
So yes, the COVID, as I said, I treat this COVID infection not as a viral infection. I treat it as a cardiovascular disease, actually, because it affects your vessels. One of the reasons why people die because of COVID or have a major complication is because they have a clots in the lungs, affects their blood vessels. Huge amount of people have a myocardial injury or a kind of pseudo heart attack kind of thing we talk about. So this is what happens in these patients. And people who already have pre-existing disease, for example, hypertension, diabetes, or a heart attacks, they are at 3 times more at risk of having a bad outcome. So it is important for these people. These are categorized, especially people with diabetes. They are more at risk of COVID. But any of those cardiovascular disease, if you develop a COVID, the chances are you are at higher risk. So that's what science is. How can we prevent? Again, the question is open right now. But what I would say that if you have these kind of diseases, keep your medications. Better your cardiovascular health is, if in case you develop a COVID, better your outcome will be. So keep on taking your medications regularly, religiously, go for out walks and reduce your weight, decrease. And Dr. Nora Avyas will talk about mental health. So those things also affect your cardiovascular health. So it's important that your cardiovascular health is good so that your body can deal with COVID infection.
Excellent.
Can I just sum up one more important thing here? Actually, being a hematologist and doing one clinic of anticoagulation clinic in a week, I have realized that during the COVID time, and especially during the lockdown, we have had far more increase in patients who are otherwise not at risk of anything. They didn't have any COVID, they didn't have anything, but they actually presented nearly about 10 to 20% increase in DVT and PEs in the patients who actually been under the lockdown and sitting in front of their computers for hours and hours together. So it's a very important thing for people who are otherwise healthy, but they are under the lockdown. Please, every hour you need to get up and move about, go to the toilet, drink a glass of water, because people are having more collateral damage because of the COVID rather than directly because of COVID. So it is a very important message to people who are otherwise healthy. Please stay mobile, active, and please don't sit on your computer, on your desk for continuously for hours and hours. I have got more patients in last 1 year with DVTP primarily because of lockdown. And we are also running a trial on tactic, because Ajay has been talking about various trials, and there is a trial called tactic which is currently running, and I'm one of the principal investigator for that. That is tocilizumab, which is a one of the inhibitors for the cytokine release, and there is also a drug called sarcilizumab, which is a drug for rheumatoid arthritis. They have shown a huge amount of promise and about 25% reduction in death on these drugs. So, but these drugs, of course, are being given in the secondary care, not in the primary care. So these were the few things to be aware about in terms of current scenario of COVID. And the scenario is changing rapidly. New drugs are being tested. There are more clinical trials running, and new evidence is coming up. It's emerging. But please make sure that you are keeping yourself active and mobile during this difficult times. Thank you very much. It was a fantastic overview of the COVID infection and the various treatments. Ajay touched upon everything possible, and I got enlightened a lot by your lecture, by your talk, Ajay. Thank you very much, and congratulations from my side. And thank you, Milan, as well.
Thank you. Yeah, thank you, Sunil. I've just picked up a good thing. So I'm actually going to stand up now. You can just see me, and I'm actually going to just do a bit of moving around just to keep myself going. So that was a really good point, because spot on. Those of you who are watching at home, please do stand up, have a bit of a walk around. It's really important for all our cardiovascular health, but obviously with your hematology background as well. So those, DVT, deep vein thrombosis, which can often and even primary care, we've seen a few more in various patients and so on, and then be coming your way. So that was a really good, actually a nice way to end the session, both on please keeping yourself fit and active, because what we do want to do is send a message of hope, of positivity as well. But as Sunil said, Ajay, thank you so much for being with us. You've done a lovely overview, but not minced anything. You've given us actually some very useful epidemiology, some statistics. So it's really been a lovely 1 hour together. And those of you just tuning in, you know that we're on our recorded channels. You can always go back and view this later on YouTube or on Facebook. So with Ajay, thank you again for being with us. I'm sure we'll see you again at some point. Maybe one passing final word of sort of positivity that you may want to share with the general public that are there to look after themselves.
I think, first of all, thank you for inviting me. It's so lovely to talk to you and Sunil and to everyone. I just want to give two things just before. It's not all doom and gloom. What I can tell you is, as I discussed in last 1 hour, most of the patients, it's a very mild disease. It's preventable. You would take precautions. Everyone takes the precautions. It improves. Vaccines probably will do a magic in some ways in terms of improving the herd immunity. And we are going to discuss about vaccines later in one of the talks. So there is lots of hope coming in. And just from my hospital perspective, I'm telling you, is now that although we have more patients, but we are losing less patients. We are making a better outcomes. So we as a doctors are knowing about this disease, treating it well. So it's there's lots of hope. So lots of hope to prevent this disease, lots of hope. Even if you get this disease, it's not going to be serious. And even if it gets serious, mostly we doctors will be able to help you come back to normal self. Thank you. Thanks a lot.
Milind, we'll have to get Ajay at some point again in other future programs to talk about the vaccine, because I think he was very eager to talk about the COVID vaccine. So we need to get him back maybe next Sunday.
Please do. Yeah, I did see your slide there. And look, again, if you've got, I know Nora's patiently waiting, ready, keeping calm, ready to start her session as well. So those, I know we are running slightly late because it's been an overrun. I know you had your slides ready there, actually, Ajay, for vaccine. Even if there's one or two key points you want to share with us, and then we should definitely get you back.
Milind, I think there's going to be a huge session for vaccine today by Dr. Pankhania. Obviously, he's a great guy. So I will not keep Nora waiting.
Fine.
Only thing just need to add with Nora is that I'm doing one of the biggest studies on mental health impact on healthcare professionals. So I'm very keen to hear what you are saying. Thank you.
Good. Excellent. Good. So to all of you watching at home, a big thank you again to Ajay Gupta. And if you're just tuning in or tuned in halfway, welcome again to Healing Our Earth every Sunday. This is the 56th session since Healing the Earth started. So a big thank you to all the directors and producers and all the people. Do go to the healingourEarth.com website to see which other sessions we've had, whether it be entertainment, music, festive sessions, cooking, every yoga, wellness. So again, to remind you of the next few sessions again coming up. So today is Sunday, the 10th of January, 2021. Next Sunday, the 17th of January, the theme will be yoga and meditation, a whole session dedicated with very leading teachers on that. So next Sunday, where will you be? Yoga and meditation. The Sunday after, the 24th, will be the vegan and vegetarian kitchen. I think these sessions have been very popular with cooks coming on and sharing very simple recipes. So that'll be the week after. And then the 31st will be well-being and wellness. Again, various motivational speakers on that theme of well-being. And then again, the week after, we'll be back again with a COVID update. Although at the moment, there are even so many updates that we may even have that fortnightly. So just to remember that Healing Our Earth is every Sunday with a variety of themes and on a variety of platforms as well. So with that, let's carry on. So Ajay, do remain on here as our, and Sunil, great to have you on. And I think we can continue asking and interacting with Nora as well. So another of our co-hosts has been Sunil. You've seen her, Sunil Gupta, who's a hematologist and oncologist based at Lewisham in Greenwich. And just reading about you, Sunil, you've really studied at some of the most prestigious places like King's College in Sydney, Australia, the North Shore Hospital, the NUH in Singapore, as well as AIMS in New Delhi. And currently, I think you're doing a lot of studies and research in various fields. So thanks for being with us. And I think soon we'll be seeing you a lot more on our screens, hosting other events as well. So with that, yes, the theme, let's move on to the theme of mental health, of our mind, of our emotions. We've talked about the science of corona, and it can get very dry at times, physical distancing, etc. But we are emotional people. We are emotional beings. We are social beings as well. So it's all well and good saying, please isolate. But what happens to the rest of our social interactions, our interactions with family, friends? What happens when anxiety reaches us? Uncertainties, loneliness, dealing with our employers, dealing with our children, all those themes we're hoping to cover now, some of them anyway, with Dr. Nora Vyas, who's also, I think, part of the Healing Our Earth team anyway, so be with us. And Nora, let's spotlight you for a moment and just welcome you to this Sunday. A namaste and a welcome to you.
A global namaste to you, Dr. Shah, and thank you so much. It's a pleasure to be on Healing Our Earth. And
yes, and then we've had you before. So I want to just tell the audience a little bit about you, and then please do, let's have an overview of the topics you're going to cover, and we can interact together as needed. So for those who have not met Nora before, or do read up on her biodata, but she'll be covering the theme of depression, anxiety, and stress management. So Nora is an associate professor of mental health and a chartered scientist, a motivational speaker. She's got a PhD in psychiatry from the University of London and has published research and presented at many conferences. In the early stages of her career, she was given very awards and recognition for her research in a particular mental illness called schizophrenia, and has been given sort of Fulbright Scholar Awards and Investigator Awards as well. More recently, she manages an Instagram account called Mental Health Connect, and you can share a bit more about that with motivational quotes and really to end the stigma around mental health and mental illness, which is such a key thing. And just as Ajay was saying at the end, healthcare professionals themselves have gone through a very difficult time, even seeking help themselves. So I think this theme of mental health is so important, and let's explore together. So Nora, again, a namaste and welcome. Let's see where our conversation can take us.
Global namaste to you and the wider audience who are tuning in today. It really is a pleasure to be here. And yeah, I just thought it'd be really nice to talk about the importance of mental health during the pandemic. I mean, all of us at the moment are going through a very rough time, if I can say that. It's a very stressful period that we're facing. And this is probably one of the most uncertain or unpredictable events that we'll probably experience in our lifetime. And I think upon reflection, I do feel that there is light at the end of the tunnel. We've gone through 2 major lockdowns, a whole tier system, and of course, currently within the UK on another lockdown. But I think if we look at it as a sort of a overarching way, we do realise that there is a bit of light. Things will get better. And of course, our scientists and our medical team have been at work so many months of hard work to ultimately get a vaccination. So I think ultimately, if we look at the bigger picture, there is a bit of light, and ultimately it does make us want to continue to do a lot of the things that the government has suggested, which is washing our hands, wearing a mask, and keeping our distance. But during this period, many of us may also feel quite stressed. We may be feeling worried. We may have a sense of low mood, or generally feeling quite lonely and anxious. So this is quite a normal experience that we may face. But what we need to remember is some of these emotions are actually quite important. They help us in responding towards these situations. So ultimately, these emotions are important, but we do need to recognize the situation we're currently in during the pandemic. And once we acknowledge these experiences, we can ultimately reduce many of these fears that we experience.
Yeah, I think that's really important to sort of have that insight to acknowledge what we're feeling. And I feel that sometimes, we'll come on to that, certainly about the information overload that people are feeling in this day and age. I think if Corona took place maybe 20 years ago without mobile phones and so on, would it be harder, different, better? Who knows? But certainly at the moment, people are feeling sometimes very overloaded with information that, do we have time to even know what's going on in our brains? So maybe you can guide us, or in our minds or emotions, and guiding us on that topic. But yes.
Yes, at the moment, yes, we are going through an overwhelming amount of information. It may come from social media, from the news. And as we know, the government's consistently updating us about anything that we need to be aware of, any changes in the regulations and any restrictions that we're on. And we did face many of these experiences in December, when we were on a different tier system, and then we were ultimately upgraded. And of course, this year we are in a lockdown situation. So I think it's important for us to be aware of the latest guidelines by the government. But at the same time, we do need to limit the amount of exposure we have of other things like social media. Some people regularly, review their Instagram pages, Snapchat, and there's so many different avenues. And they also keep their notifications on. So whenever they get an updated message, it makes a sound. And these notifications, initially, when you're not doing anything else and you don't have, the pandemic experience we're having, it may seem like, oh, great, I'm aware of something that's come to me. Let me read this message. But I think during this current circumstances where many of us are working from home, Many of us may find that our children are homeschooling. In these situations, having sounds that are going off or consistently having messages on our phones that we just almost feel like, okay, I have to check this message because it's made a sound. And that experience, I think we need to try to limit as much as possible. So what we could do in that situation is to keep our phone on silent, or to make sure that these notifications don't make a sound, so there's no sound. And I know that there's an option for that on many of our apps that we download. And that can ultimately reduce the amount of burden that we may face, because ultimately we're living beings, we're trying to cope with the situation we're currently in. And one way of being able to cope is by reducing the overwhelming amount of information, which we may already be aware of, because most of us watch the evening news, we may even be watching the government updates, the briefs. But in addition to that, do we really need to know everything what's happening? Or could we assign a time in the day that we say, you know what, I'm going to give myself half an hour or an hour to watch the news, to find out what's going on, because it's important to know what's happening, but I don't need to overwhelm myself. I don't need to overburden myself. And I think we take it quite lightly when we say it's okay, and it's important for us to know about this stuff that's going on. But at the same time, if we look at it at a deeper level, on a more constructive level, we find that we're losing a lot of energy when we are essentially immersing ourselves in this information. So I think we need to look at it as a detached individual and think, wait a minute, whenever I put the news on, I feel really drained. Do I need to watch this on a regular basis? Could I have an assigned time? So that's something we can do. Also, if you are homeschooling, it's important for us to be able to provide support, nourishment, love to the young children at this time. Children will not necessarily communicate these things to an adult, but you might see language. So you might find that the child is hugging you a lot, or they want a lot more of your time. And that's a very simple indication that mum or dad, could you give me some time today? I need to talk to you about something. Of course, kids are not going to school at the current moment. And so there might be other emotions that they're experiencing, such as not being able to meet their friends. Remember, for them, it's really quite challenging. So we need to be very much aligned with how they're feeling. And that's what we mean by that is theory of mind, understanding someone else's perspective, particularly as it's your child. So giving yourself the time, or allocating time. Maybe you can do it in assigned ways where, the husband finds time according to their calendars at later on in the morning, and then you might find that you've got a couple of meetings, but you can find time for your son or daughter maybe just before lunch. So whatever the time is, I think it's important to look at your calendars and say, you know what, let's try to have a bit of synchrony. So when the children are studying on Zoom, in terms of their lessons, at this time we can also do our work. And then once they have that break, it's important as much as possible that you also have that natural break, if it's at all possible, of course, and then to be able to dedicate that time that we can have lunch together, or at least be around in the area, because that can really feel quite comforting, that mum and dad, or I know exactly where I need to find them. All of these things meets their expectations, and it reduces the underlying anxiety that a young person may feel.
For sure, yes. I think finding that sense of routine is so important at times, particularly if you've been stuck in the house. And we heard from our last speakers that, in fact, nothing else but just be sitting down is also not good for your physical health. So it's good to be moving around as well. So look, we've got 45 minutes together, or however long it takes us to explore some of the themes. So what sort of themes did you want to feel that were important today that you wanted to sort of cover?
Yeah, so today I wanted to talk about anxiety. I also wanted to discuss depression. I felt that currently during this pandemic, clinical depression, or just generally feeling quite low in our mood is something which is quite common, but also feeling a sense of loneliness. This is experienced in all of us. At some point in our life, we've experienced a sense of loneliness, but during this time, we are asked to stay at home. And those who are living in, in large extended families might find that there's not much of a difference in terms of their experience. But those who are in nuclear families, or maybe those who are living alone, or those who are widows or widowers, they may find that this is a very difficult time. So I'd like to come up with some suggestions in terms of what we can do. For those who, for example, experiencing anxiety, I think it's important to recognize that is a completely normal way of feeling during this time, because we are experiencing underlying levels of uncertainty and unpredictability. I don't think we would ever have guessed that we would be in this situation, but we are. So acceptance is really quite important during this time. Now, what do we mean by anxiety? So this varies from person to person, and it does include, however, having a constant sense of worry, a sense of dread. It could also be experiencing a lack of concentration. And many people call these experiences COVID fatigue. So you might just sense that your muscles are quite tight, your body just feels quite heavy, you spend a lot of time alone. Of course, that experience may be more prevalent if you are also alone, living alone. You might find that you don't really have that motivation to do things that you were initially interested in doing. And you might find it really difficult to get up, get ready, have a routine in place, and not necessarily to stick to it, but to be able to get through the day, and to be able to maintain a sort of a neutral or positive sense of self. Other things could include having doubts about yourself, maybe even feeling quite depressed, low in your mood, or simply scrolling through lots of different media outlets, apps. We get so many messages which are forwarded to us, and just feeling like you're on some sort of roller coaster ride where literally anything that comes to you, any messages that come to you, any videos, you're watching those, and the day's passing, and before you know it, it's like evening, and you're thinking, what have I done today? And so there's a couple of suggestions I'd like to give, but before that, I just want to talk about the generalized anxiety disorders clinical presentation, because many of us, about 3% of the population, experience generalized anxiety disorders. And this is excessive levels of anxiety, excessive levels of worry, feeling a high level of fatigue, restlessness, almost feeling quite edgy. And it's very evident for those who are around you that, wow, I've just said something quite straightforward, but this person just seems really anxious. But I think at this time we need to let go. So if you do find that someone in your family, just as a one-off, just seems a bit edgy, a bit difficult to communicate with, give them that time. Just let go. Don't necessarily react to something that they're saying, but just go, you know what, they probably need a bit of their time to themselves. Individuals with GAD may also experience heightened levels of irritability. They may also experience difficulties in sleeping, muscle soreness, muscle aches, and this may last more than 6 months. And that's really important, because when we experienced the COVID situation, when we went into a lockdown last year in March, during that time, up until that now, it's been 9 months. So many of the generalized anxiety disorder symptoms last for at least 6 months. So if you do find that there's a consistent level of anxiety over a long period of time, it has to be about 6 months or so. And the individuals experiencing these symptoms finds it very difficult or challenging to control. This is when they need to seek support. So if you are a relative who's able to clearly observe that there is a family member who's experiencing these symptoms, and it's been going on for a long time, and even though you've tried your level best, you can still see these underlying symptoms, it's important that even if they don't want you to be joining them, that you do seek help. And I know our GP practice at the moment, they do offer online consultations. They also offer video calls that you can make. So it's really important that you make the most out of it. Submit the form online through the online consultation, and within a couple of days you'll receive a response that will try to book you into the slot. Make sure that you attend, that you are next to your phone, that you do speak with a GP, really important, and you can go through the types of experiences you're having. And how long you've been experiencing this, and they will be able to support you. It could be through cognitive therapy, it could be through some medication, and of course they'll monitor this over a course of time to see how the symptoms are, whether they're persisting or whether there's a reduction in those symptoms. So there are a couple of things that we can do. But for those who are experiencing general anxiety associated with the pandemic, which is COVID-related anxiety, there are a few things that that can be practiced. And these include things like remaining calm. And I know it sounds really straightforward. Oh, we can remain calm, but breathing exercises, breathing awareness. Just at the moment, if I was to do a breathing exercise, just taking a deep breath in and a deep breath out, right? Once again, a deep breath in, a deep breath out, a deep breath in and a deep breath out. What you might find is that if you're feeling some underlying anxiety, when you're breathing, you'll find that your breathing is quite intense and you'll feel it. But as you do this breathing in and out, it doesn't have to be a deep breath. It can be a simple just breathing, just like we're doing normally right now, but just having the awareness that you're breathing. And when you do this practice, it can really make you feel quite relaxed, and your breathing levels will gradually get to some levels of normality. Remember, oxygen is the whole and soul of our beings, right? So increasing the supply of our oxygen levels to our brains can promote calmness, and it can allow us to refocus on something else. So not just the things that are going on around us, the stresses, but also focusing on our breathing. So giving attention to our breathing can allow us to refocus and maybe also reflect upon what's going on around us once we come out of this experience. Other things that I find a lot in many individuals is that when a person experiences anxiety, they often think about the future, and having this future orientated mindset is something that we could probably choose to change. So the more we remain in the present moment, in the here and now, is something that can bring us so much more happiness than thinking about the future. Because at least at the moment, I can say for sure that we don't know what's to come in a week or two, but thinking about it can certainly bring out a lot of sleeping. So instead, if we can say, well, you know what, I'm going to monitor how things are going on at the moment, and I just want to go with the flow. I'll just take it on a day-to-day basis. That's a much positive outlook, and it allows us to think much more in a positive phase of reviewing things. Finally, we can also do a lot of exercise. Remember, Dr. Gupta was mentioning this earlier. So exercises like if you do regularly go out for walks, continue going out for those walks. If you go for runs, again, continue running. It's really important that we get that natural light, get fresh air. It's critical that we do that. So just carry on doing the activities that you've always very much enjoyed. And then finally, of course, there's also writing down a list of things that you're most grateful for. And something I like doing is having a jar where I can write short notes about what I'm grateful for. And it could be for today, it could be experiences I've been having over the last few months, but just even having a day-to-day jar of just one note that I can put in that jar and say something really nice has happened, or I feel so grateful to have a very loving family, or I feel so more grateful to have friends that I can call, without making an appointment, and things like that. So if you write a short note, it can really make you feel this sense of love, sense that there is still lots of happiness around, and there's, people are very kind. Something that we can.
Do you then dip? Sorry, just to interrupt. So do you dip back into that jar at times then, just to remind yourself, or is it sort of just to see that, look, I am grateful for so many things? I guess at times of feeling dark or down, you could dip into that jar and think, oh yes, I did say this. I'm wondering how you might use that jar as you go along.
Yeah, that's a really good question. So absolutely, it really comes down to sometimes at certain holiday periods, you might want to just tap into that jar and see, oh, wow, there's so much I can be grateful for. And even just observing that jar, the fact that you've got so many pieces of paper in there which are wrapped up, it's like bundles of joy, bundles of love. And just observing that can also give you a sense of happiness. But I think ultimately, within a few months of having that jar, you could equally so, of course, pick out something that I just at random and go, oh, wow, yeah, this is an experience I had many months ago. And then it just allows you to relive that experience. And that can bring you joy, especially during times where you might feel a little isolated or upset about something. And it just makes you remember those positive moments that you've had.
Definitely, yes. I think these, gratitude journals or writing things of gratitude has certainly become a lot more popular, and it does tell our mind that to be too grateful for what we do have. So it's certainly a theme we use in anxiety or in depression. So thanks. No, you shared some good tips already on anxiety, defining what it is, this specific condition called generalized anxiety disorder, because anxiety is a emotion or a symptom that may come to all of us, but when it's prolonged or excessive, then even tips for other family members to say, well, look, just let go or give them some extra time. And that very simple tip of just observing one's breath. And I'm sure you've come on to other Healing Our Earth sessions where we've had sort of yoga teachers and other teachers guiding us on our breath, but even a very simple observation of breath was helpful. And then, as you say, keeping that routine or exercise. I think certainly if you're watching in Britain, it is absolutely freezing in Britain at the moment. It's winter, but if you're watching around the world, it might be very warm and sunny and you can get out. But I think even if you're here, please do keep that routine and getting yourself out. And I think, Nora, I'm sure you'll cover this soon, but that motivation, I've spoken to a lot of patients who say, yeah, it's fine, but I just can't, it's too cold or I can't get myself going. So I know you're going to talk about mood and low mood in a moment, but if you can share with us some tips about motivation as well, because I think people say, I watch it on a webinar like this, but when it gets to my real life, I can't quite get it going. And any tips you may have on that?
Yes, absolutely. So during this time, I know it's a bit difficult to remain motivated or positive, and it may just seem simply that words are being said. But at the same time, I think we need to go deep within ourselves and ask ourselves, what do I need? What does this individual need? And when you ask that question, you might come up with the answer that I want to be happy, I want to be at peace. And there's a lot of things that are concerning me. So first of all, it's important that we acknowledge the experience that we're having at the moment, and that we're able to really think about it at that deeper level. Because once we acknowledge things, it allows us to feel a lot more calm, a lot more relaxed. And it allows us to get things done during the day, especially for those, let's say, who are working from home. For us, it's very, very challenging to suddenly be in an office, in a room that we've never really been working in, and suddenly to be able to get all of the tasks of the day being completed. So that can be quite a challenge. But at the same time, it's all about wake up in the morning, getting ready, wearing your office gear, and then, of course, getting an hour done of work, then walking around the house, maybe interacting with any members of your family, then getting back to work. Again, those kinds of things really does help us remain motivated. Another thing that I find quite useful is maybe going out for a quick walk. It could be a 10-minute walk or so, or even just going outside in your garden if you do have a garden. That could be really useful. Opening the window, just looking out, what's going on outside. You might see some beautiful birds, right? Chirping, for example. Just having that outside vision, taking in the light, the natural light, all of these factors could play a really important role in just making you feel that there is something beyond, being sort of having the sense of feeling cocooned, like in a room. So yes, go out there, don't feel secluded or isolated in that sense. Another thing that I think you could potentially practice is something which is relating to anxiety. So if you do have this sense of just general anxiety, you could try the RAIN approach, which is a deep breathing technique, and it allows you to first of all recognize what's going on within the self. So it's almost like a film. So when you keep your eyes closed, you might find that there's an array of thoughts that are coming in front of you. And just let those go. Recognize those thoughts that are coming, but just let those thoughts pass. Second of all, allow the experiences to be there and just as it is. So even if you're experiencing anything which is making you feel upset or anxious, just let those pass. Let those experiences just be there, but also don't hang on to those experiences. Thirdly, investigate the kindness element. There are people out there who can support you. There is always someone that you can probably call. It could be a friend, it could be a close relative, and they are literally a phone call away. So make the most out of your social network, the support you have, because I think that's ultimately something which could be really hopeful, really useful. So those are some of my tips. Another thing I wanted to talk about, actually relating to anxiety, is worrying. So you might find that you're worrying quite a bit, or it may be in a segmented sense of the word. So there are two main forms of worrying. One is a practical worry, and the second type of worry is hypothetical. So when we have a sort of a practical sense of worry, often it's when we find that it's something that we can do to reduce those worries. So it could be, for example, paying your bill, or getting a particular assignment done if you're a student. So these are things that are very practical. They can reduce your worry the moment you complete that particular task. The second form of worry is a hypothetical worry. And these tend to be about situations about the future, things that we can't really change. And these are the experiences that we're probably having at the current moment in time. So basically, we experience these hypothetical worries, experiencing uncertain situations. So there's nothing really that you can do. You might find that these hypothetical worries are relating to work, they're relating to maybe being at university, or maybe some other situation, but it may not be something that you can pinpoint and say, you know what, I can do something about it. Because if you could do something about it, it would be called a practical. What we really need to do is try to find ways of reducing these hypothetical worries. And one way of being able to do this is using the Apple. It's called the Apple technique, and it's a very effective technique of reducing worry. So what does Apple stand for? The first thing, which we've talked about previously, is acknowledgement. So acknowledging and noticing that what's in our mind right now is uncertainty. We don't know what to expect. There's unpredictability. But you are taking all the recommendations, all the advice and the actions that you need to take in order to remain safe, right? So acknowledge this, first of all. But also P, for pause. So pause for a few moments. Don't react to the thoughts and feelings that you're having in any way, and just let it go. Just let it be. It's almost like having this detached sense of what's happening currently in our situation. The third letter, P, is pull back. So pull back from the thoughts, from the feelings that you're having. And that's also relating to the previous one, which is pausing. Just pause for a moment, or then pulling back from it, being detached from the situation. That can also give you a very positive sense of what's happening. The fourth point is letting it go. So you may have heard Elsa in Frozen, they say, let it go, right? So absolutely, I very much agree. Let it go. Because when you just let go those feelings and thoughts, It can be some of these thoughts could just be thoughts that are ruminating within your mind. But if we continue to have these thoughts, may be somewhat harmful, because they can take you to a deeper and deeper in a place which requires a lot more support and love. So when you do find that these thoughts are surfacing, just say, let it go. It's okay. Things will get better. There's always light at the end of the tunnel, right? And then finally, E for explore. Explore what's going on around you right now. Refocus your attention out of your own internal world and what's happening outside of you. And that can really, really help you. It can also allow you to focus more on things like, what are you hearing at the moment? What can you see? What can you touch? How do you feel? So this is what mindfulness is all about, remaining in the current moment, taking in the energy of the current moment we're in, right? The feelings that we're having. And this can be quite useful. Another thing I think I'd like to practice with all of you, and I hope you're finding this useful, is a relaxation technique. So it's called a relaxation strategy, and this can really help you relax and sort of de-stress you. So before I start this session, I just want to say that at times we all feel a sense of tenseness in our bodies. And if we don't pay attention to it, it can naturally build up like a coiled spring, right? Literally, when we're under a lot of stress, a lot of worry. And so when we worry and when we feel really tense, something that we can do is to be able to focus on our body, focus on specific parts of our body, on our face, on our hips, for example, on our legs, on our feet. And when we bring attention to those different components, it can really allow us to de-stress and reduce the intensity of those different muscle groups. Something we can try right now is that I'd like you to work through your body. And what you want to do is tense certain aspects of your body that I'll talk about, and have that tense experience for about 5 seconds, and then reduce and then stop. So after 5 seconds, if you just tense those muscles and then reduce and then just stop tensing those, then it can give you a better experience. So let's try this, and I'll try to put some nice music on in the background.
I think everyone's ready. So hopefully those at home, while Nora's getting ready, some really helpful tips there. I like the Apple acronym as well, and even your renditioning of Let It Go. Excellent. I think it was good things. And let's get ready to maybe relax those parts of our body, and that would be helpful, because I think sometimes we don't know, we've been sort of carrying a lot of tension, and it's only when someone comes to us and says, oh God, particularly I think for me it's always shoulders. It's, oh, your shoulders are really hunched up, or your back is really stiff, or whatever. And there's certain points of our body, and it's a very interesting point, without elaborating too much, but those tensions affect different people's bodies in different ways. And even as a GP, I'll see, they'll say, doctor, that when I get tense, my stomach always cramps up, or actually my asthma always gets worse, or that's when my headaches come on. And I think each of our bodies are so unique that they'll come in different areas. So it'll be interesting to see some relaxation techniques now.
Dr. Nora, if you can hear me, this is the producer director. If you're using any music, please make sure it's not a copyright music. If it is, please avoid music. Thank you. Over and out.
We mean to unmute you. If you can unmute yourself, Nora. If you can just,
yes.
That's it.
Okay.
Yeah, got it.
Yeah. Okay, so what we will do is that we'll work through our body, and we will tense approximately 5 seconds of our muscle groups, and then we'll rapidly go on to another area. Okay, so first of all, I'd just like you to relax. Take a natural breath in and out. Another breath in and out. Deep breath in and out. And what we'll do is we'll start on the forehead, and we will lift our eyebrows as high as possible, just like I'm doing. We do that for about 5 seconds. Okay? And then we'll just relax. And we focus on our face. I'd like you to tighten up the muscles in your face, the cheeks and the nose, and hold it tense for about 5 seconds. Let go. Now you can focus on your shoulders. I'd like you to lift up your shoulders, right, like this. This is for all age groups. I just want you to move them forward like this. And then backwards. Okay. And then I'd like you to tense those muscles, those muscle groups. So just tense your arms like that. And then let go. Once again. Let go. And now if we go below to the tummy muscles, I'd like you to pull your tummy muscles in for about 5 seconds. And out. Once again, in. Out. And if you go further down to my entire right leg, so put my leg out and tense them. So you can put your leg out. I can't demonstrate this, but it's like pulling it out in that fashion and then putting it back in towards you and just tensing your muscles. Okay, and now if we shift to the entire left leg, I'd like you to lift your leg up and then down. And I'd like you to tense those leg muscles. And also the calf muscles, right? This is below the knee. So it's the lower right and left leg. So if you just tense the calf muscles. And then let go. And then finally, we come to our foot. This is the one that carries all the burdens right of the day when we're walking around. So I'd like you to just move your foot like this. Just rotate your foot, right? Right, and then left, the other way around. Okay. Okay, so this is something we can do for our physical selves. It's really important in order to maintain our mental health to keep to a daily routine. So there are 3 key factors that we probably need to reflect upon. It's things that we need to do which are necessary things. So these are things like going around our normal day-to-day life, might involve, paying our bills, getting things done. It might be work related, but also pleasurable activities. So if we do like to go for a walk, we like to spend time with our family, our children, that's equally important as part of our routine. But even day-to-day things like doing the laundry, equally important that we're able to focus our energy on getting all of these 3 things done. And I think it might be a bit of a juggle. I think what we need to do is obviously recognize this, that it may be challenging, but I'll try to do as much as I can, as much as is feasible. Another thing I'd recommend is get as much natural light and nature as you can and what is feasible. So during the day, for example, particularly during the winter period, things are quite dull. So if there is a bit of sun, do try to spend a lot of time near the window where you can get that natural light. It's really, really important. Of course, it does help with the vitamin D, but equally so, it makes you feel quite energized in the morning. So take in that natural light. Try to stay active, eat a really balanced meal, do these exercises, taking a deep breath in and out, depending on your health, of course. Do some stretches, even if you find that you're unable to physically go out. Stretching your muscle groups is really important. Even standing up and down. There's some simple activities you can do on a chair, just simply by sitting on a comfortable chair and just getting up and down a couple of times. That can be really, really helpful. And sleeping well. Make sure you get your 7 to 8 hours sleep. If you find that you do tend to naturally wake up really early in the morning, then you might want to sleep early in the evening, so that you're able to at least have the minimum number of hours needed to keep yourself alert during the day. Social media plays a very important role, and of course the news is important, but excessive amounts of using social media can increase anxiety. It can also make us feel quite moody or upset. We might not be able to pin down what bringing about those experiences, but if we do reflect on what we've been doing during the day, we'll find that, okay, you know what, I have actually watched something which is quite upsetting, and that's why a few hours down the line, I feel quite agitated or irritable. So this is something that you might find. Connect with your loved ones. I think all of us are expecting a phone call, don't you think? I certainly do. I absolutely love it if someone sends me a message. It could be a hi, how are you? Or if I connect with my family and friends, it really does make a difference. So, you know, pick up the phone, call someone, send a message. There is someone out there hoping that you'll contact them. So try to connect with your family and friends. Don't lose the connection. I know it's been a long ride. It's been 9 months and we're still counting, but things will get better. But we shouldn't forget to connect with our family and our friends. Just imagine connecting with a really close family member after 12 months. That's not so great. So continue to connect with your loved ones on a regular basis. And like I mentioned before, have a pot, a jar of things that you're most grateful for, because this can really, really make you feel quite positive, and it can make you feel that, you know, there is something beyond all of these challenges that we're experiencing, in the current times. Another thing, if I may, Dr. Minor, is I wanted to talk about loneliness, because I do remember promising that I would talk about that. So a couple of tips that I'd like to give in the last 6 or 7 minutes or so that we have. Loneliness is actually quite common, and it's found in about 27% of the population, right? So we do experience this quite regularly. And in the UK, 1.4 million individuals who are chronically lonely, and many of them are older adults, and so it's actually quite common, and there is something that we need to do about this, particularly during the pandemic. It's important that we check in with our loved ones. We do know who they are, right? There could be our grandparents who are living in a different home. There could be our extended family that we are aware that they are alone and they might need help or support when it comes to shopping, right? They may have difficulties when it comes to tapping into media. So for us, it may be quite straightforward to go to our online grocery shop and simply tap into, oh, I want to buy all of these things. But for them, it may be a challenge. So I think we need to understand where they're coming from, some of the challenges they're experiencing, and really to step up. And this is the time, folks, for us to step up for those who are in need, especially the elderly and children. Equally important that we are able to, really give our time to them. Remember that it's important equally to just share your experiences. If you have a simple few words, it can really probe others to talk about their experiences. So if you start off by saying, how are you doing? This is what I've been up to. How's your day gone? Then it's likely that they will also share things. But if you keep it very simple, such as saying, how are you doing? Are you okay? Great. Okay. And you're not sharing too much, the chances are that they won't share things either. So that's something we can do. And equally so, try to continue doing hobbies that you're currently interested in. If you are lonely, maybe cooking, maybe entertaining yourself. If there's certain programs that you watch, that's great, but don't get overwhelmed. Some people have this binge watching, and I know there's been a lot in the news about that, where people in the UK are doing 80, I think it's 28 hours of binge watching, and that's fine. There's nothing wrong in watching series, but I think what we do find is that entire day has gone past before we knew it. And you start at lunchtime, and before you know it, it's 8 or 9 p.m. You're thinking, wow, the entire day's gone. But that's what happens when we binge watch. So try to allocate time for watching programs, giving yourself me time, things that you want to do, things that you find quite energizing and quite positive. And that's something which I hope you'll find useful.
Thanks so much, Nora, so far. I mean, I think we've just tapped on the surface at the moment. I think we're just carrying on this theme, really. And I've picked up certainly on loneliness, such a key topic that's affecting so many people, and some themes there of just connecting. So everyone who's watching, you may yourself be alone, or you may know someone. Please do call them up or connect with them in whatever way. And I liked your point actually of sharing some sort of experience. And I think you're right. So how are you doing? And that's it. But actually, if you share, well, this is what I went through today or something, it requires a bit of strength for us to open up, but it doesn't have to be anything too profound. So that was a really good point as well. And then going back on one point you mentioned about light and sunlight, and particularly at the moment, our northern hemisphere countries like UK are sort of very dark at the moment. And there is a condition, as you've probably come across, called seasonal affective disorder, or SAD. And I don't know if you've come across that, or certainly people, we know many, certainly many of Indian origin be watching, who've maybe originally from India or from East Africa or elsewhere, or the Southern Hemisphere, or certainly our genetics are like that. And maybe we're used to being in brighter environments. And I wonder what your thoughts were about this seasonal change and people feeling lower in the winter periods.
Yes, so during this time, it's very common. Seasonal affective disorder is essentially when a person experiences a drop in their mood. They feel quite anxious. They may have this irritability, helplessness, maybe experiencing mood swings. And this is quite common during the winter periods. There's something in terms of what we can do. I think light therapy really does help. It's an effective way of being able to reduce SAD, which is the acronym used for seasonal affective disorder. And it could be something like this, what I've got here, this light. So just turning on that light, having light in the house can certainly help, even if there isn't much natural light out there. It's all about trying to find ways of being able to maintain your mental health. Positivity, of course, that's another element of it's an extension of how we feel, but there's other things that we can do within our day-to-day life that can make us feel so much more, positive in terms of looking out, in terms of how we feel. Those people who experience seasonal affective disorder, there are a couple of things that they can do. Of course, light therapy is quite effective, but if things start to worsen over time, there are treatments, of course, for this. And I would definitely recommend liaising with your general physician, maybe talking to someone, because there are strategies to be able to reduce these experiences, such as negative affect. Having these negative experiences, maybe you're thinking about what the future may hold. And so having some form of intervention can really help. I think another thing, of course, is I remember, Milan, you were talking about working from home and some others, and I just wanted to tap into that for a moment. So many of us, of course, find ourselves are working from home because of COVID-19. But I think with the right effort, you can stay quite productive while also taking care, of course, of yourself and your loved ones. I want you to all remember, as we finish the session, that everyone's in the same boat. And I know that sounds really cliche, but I think equally, we need to realize that we're all in it together. Each of our situations may be unique, unique, maybe in different circumstances. We may be in a big family, we may be living in a nuclear family or completely or alone. But I think what we do need to realize is that we do have compassion, we do have understanding, and that we also have empathy for everyone who's involved. And this is really important. We need to tap in to our inner values during this time, and to be able to find a strategy that would work for us during this period where we're working from home. So a couple of tips I just want to give. First of all, it's important that we design a workplace that works for us. So we might not necessarily have a workplace, right? And I'm sure that since March, all of us have we probably do have a space in our house where we can work. But it's really important that you allocate a space in your house for work, because when you allocate a space for work, it sends a signal to the brain that this is where I'm going to be focusing. This is where I'm going to be able to get things done. Equally so, it's important to come out of that environment as well. So if you're working, great, stay in that environment. But the moment you've finished your work, try to come out of that environment. Don't do things like working in that environment, also having a great time watching a program that you like in that same environment, because then you won't be able to make a balance between work and fun, like things that you actually want to do. Second of all, move around. This is something that Dr. Gupta was mentioning earlier. So find, some of us might have mobile workspaces, so it may be a bit difficult to have an allocated workspace. So if you do have a mobile workplace, that's fine, but try to make sure that it works for you. For many people, they like to stay in one place for work-related factors, right? So be on a table, as opposed to, let's say, being in a comfortable sofa, for example, and also being in a lounge with lots of activity. So you might want to find ways of being able to as well as having a workstation like your laptop, also being in a very comfortable place, so that your ergonomics aspects are well done, which basically means that you can remove the risk of any musculoskeletal injuries, which are likely to happen when you stay in one place for long periods. Get ready for the day. Have your shower in the morning. I know this sounds really unusual what I'm saying, but it's things that people don't do sometimes. They think, oh, I'm at home, so I don't need to shower early morning. I'm just going to shower later on. And these are not good practices. So, do the things that you do on a normal day-to-day basis. Wake up, have an alarm if that helps. I think it does help, actually. Get ready. If it is a working week, get ready in your work gear. Wear your shirt if you're a male, wear your dress. It's really important because it trains the mind that I'm going to work, even though you're not physically going to work. You just feel that, okay, I'm in the work mode. Set a schedule, put something in writing. Having a detailed to-do list can be really helpful. And when you have these ticking exercises, which I absolutely love, it really does motivate you to get things completed. So I need to get this done, right, have I done it? And then you have an entire list. And as you tick, 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 it makes you feel that you've accomplished something. Don't miss your meals. Creating a eating plan or meal plan is equally important. During the day, you might want to cut down on carbs because it doesn't help. So having a high carb diet for lunch may not work so well as having, let's say, a more balanced diet, high protein, low fat diet. That may be more effective in the long run. It can also help in terms of your concentration levels, in terms of providing high levels of alertness. So if you can do that, I think we're all in a good space. So yeah, I hope you found this useful, and I do wish you all the best during this lockdown, because I know it's a bit tough, but hopefully things will improve over the next month or so.
That's right. We'll remain positive and see what 2021 is bringing, but really important, bringing that whole mental health aspect to us. And Nora, thanks so much for bringing that whole social side of us as well, connecting with people, with family, those around us. And that's what I'm taking away. And that of routine. I think it's really important because you and I, we spoke about sort of people working from home, and there are lots of jokes of people sort of working in their pajamas or whatever, and then suddenly just changing at the last minute if they've got to go on a Zoom meeting. But actually, you're right, keeping that routine, even, keeping a tick list, keeping oneself physically active. So those are really important points in how our physical routine works with our mental health. I think we didn't cover all the things we wanted to cover, but particularly that theme of anxiety, of letting go, watching one's mind, and those themes of mindfulness. So Nora, we'll see you again, I'm sure, very soon. So with that, thanks again for joining us. Maybe one final word of positivity to leave us with.
Yeah, I'd just like to wish everyone lots of happiness. Do something that works for you during this time. You know your circumstances far more better than anyone else. So do something that creates a sense of purpose, creates a sense that, you know, you're happy in the moment you are, and do have hope. Having hope in your heart really does help. So just realize that, you know, things will improve, but you do need to, you know, stick to the government guidelines, keeping the distance, wearing your mask, and remaining safe. It's really, really important. So do follow the guidelines, but yeah, do something that keeps you happy, connect with your loved ones. And yeah, that's all I wanted to say. Thank you very much, Dr. Shah. It's been a pleasure to be on Healing Hour.
And we'll see you again. You're part of our team, and bringing this whole theme of mental health, particularly to a wider community, as we know it remains a taboo subject, sometimes talking about our feelings. And as Dr. Gupta was saying before, I think he's got an interest in mental health in physicians as well, which are a particular profession, or all healthcare professions, are that much more at risk of this topic called burnout. And maybe we'll explore that next time, what that topic means, etc., and all those things. So thanks, Nora. Thanks for being with us, and we'll see you soon. Over to the other side of the world. So it's a deja vu again. So Sheila, a warm welcome to Sheila Dobby from America. So hopefully we can see you looking great as ever. Good morning to you.
Good morning. I just got up. So I listened to a little bit of Dr. Nora's amazing session, and she's always giving us such great advice, especially during this difficult time. How are you, Dr. Millen?
I'm well, and I can tell from Nora's tips, I think I can definitely tell you've showered. I can definitely tell you're in your work clothes. So you're already forming a good routine already. So that's good.
I have to say, I haven't had a haircut in about a year now, so you can't even see the end of my hair.
Oh my
I'm just
gosh.
becoming like Rapunzel.
Well, I've had a bit of a trim today. That's as good as it gets. But that is one of people's anxieties. How am I going to get to the barbers? I think there's a meme that goes around on WhatsApp saying a woman leaving her husband saying, "I'm moving in with a hairdresser because that's where I messed up in the last lockdown." So, but good to see you. So a warm welcome to all our viewers. It's time for me to sign out at the moment. So Sheila, I'll show you again. I showed at the beginning because I've been vaccinating all weekend. So here's the AstraZeneca vaccine. Here's a vial, and here's the Pfizer vaccine. So I've been busy. We've vaccinated about 1,000 of our over 80s in the last few days here in freezing England. But it's been a very humbling experience to see sort of a lot of my patients who are, well, as you know, the British guidelines are we're starting with our over 80s. And so they've been queuing up in 0-degree temperatures and having their vaccine given. So, but we've got
great. I'm so glad that that's what you're doing out there. We've just kind of started vaccinating out here. The second round is coming out for some of the healthcare workers. We don't have the AstraZeneca one out here, but we have the Pfizer and the Moderna one.
Great, yeah, and we'll be hearing about it. So to all our viewers, just to briefly introduce Sheila to the screen, and I can see Dr. Chirag has also joined, and I'll leave you in Sheila's capable hands. We've got some great speakers. Great, and looking good in your scrubs.
Hey, yeah, I'm on call this weekend at the hospital. So I have showered for sure, I can guarantee.
Excellent. No, we're really looking forward to hearing from you.
Yeah.
So, as we said, we've got friends here who are working in the hospitals, and the cases are going up. But we want to bring positivity as well. But really, with that message to everyone who's watching, do look after yourselves, stay home, stay safe, and stay positive as these times go by, particularly these next coming months. Different countries are having different waves and spikes at the moment. So Sheila, just for those who have not met Sheila before, Sheila Dobby is one of obviously our Healing Our Earth hosts, is a whole health dentist, initially from England. So we might get her accent being more British, but being in America, is an entrepreneur, a TV host, but it has done a lot of humanitarian work as well, and has won many awards, being a sort of female, the Bay Area Dentist of the Year, and really in her theme of dental health. So with that, I know you've got some great speakers. We've got Dr. Chirag Pandya just in a moment, and we've got Dr. Bharat in a moment speaking about the vaccines as well a bit later on. So I'm going to sign off. So those who are watching, thank you for a lovely 2 hours. I really enjoyed with Dr. Gupta, who gave us a great overview on coronavirus, and that perfectly moved on to Dr. Nora Vyas, who really covered some key aspects of mental health, and I really enjoyed the anxiety topics and relaxation. So finally, leaving you with what's happening in the coming weeks. So Healing Our Earth is a platform for many different topics. Next week, I'm just looking down to remind myself, next week is the 17th of January, yoga and meditation all day on the session. The 24th will be the vegan and vegetarian kitchen. And the 31st of January will be well-being and wellness. So lots of things, yoga, meditation, cooking, well-being. What more do you need? Sheila, over to you.
Thank you, Dr. Milan. Thank you for such a wonderful introduction, and I'm looking forward to all the fellow sessions that are coming on, and looking forward to seeing you again. Thank you. So our next guest, as you've heard and seen, is Dr. Chirag Pandya. He's a board-certified pulmonologist and a critical care medicine specialist. Dr. Chirag is currently serving as a medical director of critical care and respiratory therapy at Stanford Healthcare Valley Care in Pleasanton. That's in the Bay Area in the United States of America. Dr. Chirag is certified and trained in sleep medicine and in interventional pulmonology. He focuses on advanced procedures, including endobronchial valve placement. How are you, Dr. Chirag? Good to see you.
Good to see you, Sheila. How are you?
I'm good, I'm good. It's always a pleasure to have you on. And I know you've been really busy. I've literally just got up, but you've been working for many hours there at Stanford. How is it going out there? How are the wards? Are they filling up?
It's been, Bay Area is, as you know, California itself is, currently the epicenter of COVID in US, and Bay Area and Northern California are getting the same hit as well. Not at the same level of magnitude as Southern California or Los Angeles, but definitely a lot of activity. Starting earlier part of this week, we are seeing things settling down a little bit. But this may be the end of the effect we have seen after Thanksgiving, and we have to see how things go starting next week when we start seeing a couple weeks out after the Christmas and New Year's holidays. So January still is something I think we'll have to watch closely and see how we are doing. But overall, it's still keeping us busy for sure. Yeah.
And the demographics that you're seeing, are you still seeing the same demographic, the elderly population, the immunocompromised people, or are you finding more younger people affected?
Interestingly, we are seeing across all ages of adults, and even adults who are sick enough, who are in the hospital. We are seeing all ages starting 18 and above, patients in 30s, 40s, 50s, similarly those who are in 70s and 80s as well. And it's interesting because there are times where we see patients who are older, 70 plus, but they are not necessarily that sick. And there are patients who are younger, but they have underlying comorbidities like diabetes, or if they have symptoms which are ongoing for several days or several weeks, and they are hoping to get better, waiting at home, worried about going to the hospital, and that delay sometimes make the younger patients even more sicker. So we are seeing this on both spectrums. There is definitely a lot more awareness about symptoms of COVID, about getting tested, about getting access to getting tested, compared to what we saw during the earlier part of pandemic last year, somewhere between March to May. So we are seeing patients coming in early, contacting us early, especially those with underlying comorbidities or underlying medical problems who are waiting at home, hoping to get better without going to the emergency room. They are reaching out a lot more than earlier part of last year. Yeah.
What are the early signs that you should actually call and get help?
So early signs for COVID, it can be as simple as just having fatigue or just having low energy, or it could be just feeling that you may have a low grade fever or body aches or chills. Just like any other viral infection or cold that you may have during winter or during a particular season where we see a lot of viral infections. It makes it a little bit challenging right now for patients, and sometimes healthcare workers as well, because sometimes patients around this time of the year will feel it's winter, it's cold. It could be just a simple, viral infection, a seasonal viral infection, or maybe flu, and they will not necessarily think it's COVID. But sometimes simple symptoms like having just body ache, chills, just not feeling well, having low energy, or having that possible feeling of fever, those could be the earliest sign of having COVID infection. So and compared to the advanced symptoms, which could be sometimes start as having cough with a lot of congestion, feeling of this mucus filled in the lungs, having difficulty clearing up that mucus, and feeling short of breath with your day-to-day activities. For an example, you are doing your day-to-day work, walking within the house or going for a walk outside the home, and you have a little bit of body ache, you feel like you're getting short of breath or winded, taking your usual activity, those could be signs for possible infection with COVID as well. So symptoms vary a lot. We have not been able to identify risk factors where what particular age group will have what kind of symptoms of onset symptoms, but we have seen them across the board at different degree and all across all ages. Yeah.
So as soon as you start getting some of these signs and symptoms, it's advisable obviously to go and get a COVID test. And I know a lot of places now you just phone up your medical doctor and there's advice over the phone. But at what point do you think, okay, this is the time I need to call and get an ambulance and actually go to a hospital?
Absolutely. This is something that, we continue to increase awareness for patients. And awareness is a lot better compared to last year when we were learning about the SARS-CoV virus, we were learning about COVID. But still, in general, when someone is feeling sick, if it is something unusual, then they usually feel with their symptoms. A lot of patients who have chronic lung conditions, chronic heart conditions, they feel tired, feel short of breath after doing their routine activity on regular basis. And that may be their baseline or something they live with years. But if they notice that they are getting more short of breath with less activity, that's the time to call your doctor right away, your primary care doctor, your specialist, whoever you think you can reach them, whoever you can get the message across, is better to get hold of them, discuss with them. These days with the access with telemedicine, video conferencing, all the physicians across the world, across the US, I'm sure UK, they are able to communicate with patients by video conferencing. I do 30 to 40% of my patient visits a day when I'm in the office by doing video conference. And these are the conversations I'm having. A lot of patients will reach out and say, I'm having this dryness in my throat. I'm having this cough, which is dry. I'm not coughing much phlegm, but it's just not going away. It's been 4 days. I'm having body aches. So best is to reach out to your doctor. You can email your doctor. You can call doctor's office, whatever way you can. And most of the time, the doctor will ask for an appointment, most likely video visit, to understand the symptoms, because sometimes it could be just related to allergy symptom, especially if you live here in the Bay Area. As you know, there are a lot of allergies. And that really makes it challenging for patients sometimes, because we see a lot of allergies around the time of this year, a lot of sneezing, a lot of coughing, a lot of just itchy eyes, runny eyes, and patients are worried. They're worried, is it COVID, is it not? But it's best to reach out, no matter what degree of symptoms, what level of symptoms you are having, communicate with your physicians, reach out to them. Obviously, if they are feeling that their breathing is getting really worse, they're getting short of breath with few steps or minimal activity, if they are feeling dizzy, lightheaded, having shakes, chills, having blurry vision, if you're having those symptoms, or if you are having cough, which is a lot of mucus coming out, if you're starting to cough a little bit of blood, then these are all the signs that you need to go to emergency room right away and seek care right away, because these symptoms can be related to low oxygen levels. These days, a lot of patients have access to oxygen meters. I have a lot of patients who will buy the oxygen meters through Amazon or online. They are readily available compared to last year, and they will measure their oxygen levels. And that's one way to do this as well. If you are concerned, you can always reach out and buy, especially if you have underlying lung problems, chronic heart problems, diabetes, asthma. You want to purchase that oxygen meter right now. They're not very expensive. You want to keep it at home and monitor your oxygen level if your symptoms are getting worse than your usual baseline. And if you notice that is something that is consistently running low, somewhere at 92% or below, it's a good idea to reach out to your physician, your specialist, and report it to them, because sometimes it can be as low as 85 or lower, and then your physician may advise you to go to emergency room right away. So symptoms can vary at different level of infection, depending upon the underlying health conditions. But the best is to reach out to the physician, and if the other symptoms I mentioned, if patients are experiencing that or anybody experiencing, immediately reach out for emergency help, because you want to make sure oxygen level is okay. Oxygen needs to be delivered, because that can really help early on. There are a lot of things we can do early on. For example, giving steroids, especially when oxygen levels are low, which is something we have learned compared to last year, and makes a big difference in terms of the overall recovery, and especially when we attack or treat the patient in the early part of the disease. Yeah.
Thank you. So you mentioned measuring the oxygen in the blood level, and now you did say that online you could get them. You put them on your finger. A lot of the smartwatches have the oxygen meter. What is the range? You did say if it drops down to about 80s, but is it okay once in a while drops down to 80s? How do we monitor using that machine?
That's a question that I get asked by a lot of patients and a lot of folks as well, and sometimes it becomes tricky, because sometimes oxygen level dips once below 90 and the rest of the time is fine. There are some things to keep in mind, for all the female patients in general. If you have nail polish, you want to make sure it's all cleared up, because or anybody who has any kind of paint or polish on nail, or any problems with that, skin breakdown below in your finger, you want to make sure you select area with a nail bed which is clear, there is no polish or paint there. You want to make sure you check it at least about 2 to 3 times in an interval of at least about 5 to 10 minutes. So you make sure it is consistent, because sometimes it dips one time and the rest of the time is fine, and it can create a lot of panic and stress. So it's important to make sure that you check it at least about 2 to 3 times. You keep at least about 10 to 15 minutes gaps in between, and see what the level is. Generally, if the level is starting to run somewhere around close to 92% or below, that's something consistently running low, then it's time to reach out to your physician. If it's below 90%, then it's already a sign that your oxygen level is dipping below normal. So generally, now it depends on underlying lung disease, underlying heart disease, but generally the lowest level of normal range is around 90%. If it's below 90%, then it's definitely very low and requires emergency use or use of oxygen. Now there are conditions involving lungs, for example, COPD or emphysema or pulmonary fibrosis, where sometimes we feel comfortable with patients having their oxygen levels somewhere around 88 to 90% as well. For those patients, depending upon your physician that's treating you, you may be okay somewhere between 88% and higher. So in those cases, when you have underlying heart or lung problems, you want to reach out to your physician who is treating you, primary care or specialist, and find out what is the range that you should be reporting it to them. But if you don't have underlying heart problems, lung problems, you're healthy otherwise overall, is something to keep an eye. If it's starting to dip 92% or below, and especially below 90, that's the time, if it's consistently low, to reach out to a physician or emergency care. Yeah. And watch, you mentioned the watches. I'm sorry to interrupt. That's an important point you brought up, because I'm hearing from a lot of patients who are using new watches which are coming out, which are giving pulse oximeter readings, and they're actually very helpful. I have taken care of some patients, few with COVID, where their watch reported oxygen levels to be running below 90% and giving them the alarm on consistent basis. They came to emergency room. I have seen them. Few of them turned out to be COVID positive, no prior lung or heart issues as well. So technology is really helping. I think that's something we are very fortunate to have in areas or parts of the world where patients have access to technology, whether it's a watch or pulse ox. It definitely helps in detecting it early, and helps us intervene early, to treat these patients. Yeah.
Thank you for that clarification. Yeah, it's amazing the technology that's out there now. You can kind of exercise, it's all getting monitored, oxygen's getting monitored, so that's great. So that's on our end. I can't imagine what it must be like in a hospital, the technology that you guys have. Can you share with us a little bit about the advancements that you've seen? You mentioned now using steroids. Are we really getting to understand more about this virus now so that we can treat it better?
Yes, I think compared to beginning of the pandemic last year, especially at the time from February until May or June, we were sort of in a stage where we were not clear in terms of what will be our first line, second line, third line option, what interventions we should be doing first. And now compared to that, we do have a lot more clarity in terms of treating them, and because of that, we are putting a lot less patients on the ventilator compared to what we are doing during the early part of pandemic. We are putting most of the patients where oxygen levels were starting to run low, or when they're requiring higher level of oxygen, on the ventilator early part of last year. Compared to that, these days we have access, and we have learned that if we give oxygen with a specialized delivery, for example, high flow oxygen, where we can give a very high concentration of oxygen with a very high speed. So we are giving high concentration with the fastest speed, really supports these patients' breathing while the lungs are healing, while they are struggling to breathe. That high flow coming in really gives them support close to a ventilator. And because of that, we are able to hold on to them on this therapy for several days. And then we are seeing that we have to put a lot less patients on the ventilator. And by putting a lot less patients on the ventilator, we are able to prioritize those patients who really need ventilator, use our ICU beds accordingly, and definitely help these patients recover faster, get out of the hospital faster, and get home faster. Steroids, on the other hand, we have some clear idea about what dose of steroid works, what kind of steroid works, and what duration or how long we need to continue that. We have data from multiple countries confirming this evidence, and we are seeing that no matter what dose of steroid you are using, but if you are using a particular dose early on, especially when the diagnosis is made, patient's symptoms start within 3 to 5 days, and if their oxygen level is running low, giving them steroids early on really improves their overall health, and they are staying in the hospital a lot less, they are needing ventilator a lot less compared to before, and makes a big difference. Therapy, similarly to antiviral therapy, remdesivir still remains one of the main medical therapies or medications, antiviral. If the patients are diagnosed within 3 to 5 days of onset of symptoms, then giving this makes a big difference for them, is a lot more effective. If the diagnosis is done more than 7 days, 8 days, or 10 days later part after the onset of symptoms, then the effectiveness is not that much. And in those cases, we are not using the antiviral or remdesivir at the time. However, early on, we are still using that. Proning is something that asking patients or somebody who has COVID infection to have them sleep on their chest and their stomach for up to 14 to 16 hours a day, as opposed to sleeping on the back, makes a big difference. Because when you are sleeping with on your chest or your stomach in a prone position, that's what we call it, up to 14 to 16 hours in a day, it really allows the back of the lungs, which are normally supposed to be down when you sleep on your back, to open up. And that's where we have learned that SARS-CoV COVID virus really affects the lungs, the lower part of the lungs, the back of the lungs. So by sleeping on the chest, sleeping on the belly, abdomen, it really allows those lungs in the back, those parts of the lungs, to have more rest, allows it to open up, and these patients will recover a lot more faster. It's unbelievable. So all these patients, when they come in, we quickly, our nursing staff have a policy, have an order set that is automatically ordered and built up for these admissions. We have built what we call as order sets. As soon as these patients are admitted, a doctor will click few buttons, it will go in the system. Nursing staff will get those orders, and they will discuss the patients, inform them what proning means, how they need to do it. And they will explain to them. Patients will start doing them. And again, we are using technology access. We have, a lot of these rooms with cameras, with audio and video access. So even though we cannot go to every room at the same time at the central monitor station, we'll communicate with these patients and tell them how they are doing during proning, how they are doing it properly. We are encouraging them to do it as much as possible. But these things are something early on that we do right away from the get-go compared to before, and we're able to treat patients a lot more faster and a lot more effectively. Absolutely.
So would it be advisable, if you are getting the early signs of COVID, to actually start sleeping that way at home? Just start laying on your front.
Yes, I think you're making a great point, and that's something I've advised a lot of patients who are not sick enough to come to the hospital, but they are infected with COVID. They are having symptoms. So we will definitely encourage them to do that at home. We'll email them or send them videos, pictures, ask them to look on the internet. And amazingly, patients are very compliant with this. They do this at home and they feel the difference. I'll see the email from them 2 or 3 days later. Hey, I started sleeping on my stomach and I'm coughing less. My breathing is getting better. It's amazing. So as simple things like this making a big difference. So yeah, anybody who is infected or who is COVID, suffering with COVID at home, or their loved ones, I will definitely encourage to do this at home as much as possible, as long as they can do it safely. Now, there are some patients who are not able to do that. Again, patients with chronic heart and lung conditions, sometimes sleeping that way will make their breathing worse. Or sometimes they have had surgeries done on the front of their chest or front of their abdomen, their belly, that will not allow them to do that. So there are limitations. Older folks, especially those with some mental disabilities, some dementia, have difficult time understanding and doing it. So in those cases, we try to do it in the hospital with nursing assistants because we have resources. But at home, for those patients, you want to be careful because sometimes that can make their breathing worse. And if they need to turn back on their back, it may be harder unless they have support. But as much as possible safely, it's definitely something to do at home. Yeah.
Thank you for that. So Dr. Chirag, we had a question coming in and it said, what are the typical symptoms of low oxygen levels?
I think that's a very good question, and I think it's something that we need to share with more patients and more people overall. The first sign of low oxygen could be as simple as just feeling little lightheaded or dizzy. So compared to your normal health, whether you are sitting, whether you are just resting or walking, you may feel a little dizzy or lightheaded. Sometimes you will have a view of your vision being blurry. This could be the earliest signs. Sometimes patients will have an episode where they will basically feel dizzy and they will almost feel like they are going to fall. Sometimes you will notice that the skin color will start changing. The areas where color can change first is to look for is the fingertips as well as the lips. It may start looking a little bit bluish and start looking a little bit less reddish depending upon the degree. You may see there is a lighter blue or darker blue color change in the lips and the fingertips and the toes. Sometimes you see this tiny red spots, we call it petechia, which are seen at the tips of the finger or toes. These are some usually we see when oxygen level is very low. However, these are the things that you can definitely see. Other things to watch for is increase in the breathing. The number of times you're taking breath goes faster. You feel like you have to breathe faster to do just normal walking within the home or doing your day-to-day activities. Sometimes you feel like your heart is beating faster. You may start feeling that pounding of your heart, because remember, when the oxygen level starts dropping, the heart and the lung are trying to compensate to squeeze in every drop of the blood to all the parts of the body. So heart is going to start beating faster. You're going to feel like you're trying to breathe faster because you want to inhale, get more oxygen in your lungs and deliver to all the organs. So these are all the signs that oxygen level might be running low or starting to dip lower. Yeah.
And how soon does this happen? Do you have, does it happen quite drastically, or do you have kind of time to get help? Or
Yes, it depends on the degree of the drop. If the drop is happening intermittently, if it's happening for few times a day, then you may not notice these symptoms at the time, other than feeling a little dizzy. But if it's consistently running low, then you're talking these symptoms starting within few minutes, and especially feeling dizzy or lightheaded, or color change in your toes or your fingers or your lips, and then eventually few minutes longer, you'll start noticing that you're starting to feel short of breath, your work of breathing or your respiratory rate, or you're breathing faster, or your heart will be starting to pound, or you'll be having some palpitations as well. So consistently, if the level is running consistently low, these symptoms will continue to be ongoing. Every few minutes, it will start increasing. If it's dipping few times a day, not consistently running low, then it might be just a little lightheadedness or dizziness.
Got it. What concerns do you have, Dr. Chirag, with the long-term effects of COVID-19? I know they're doing a study right now with about 32,000 people with the long hauler syndrome, they call it. Can you talk a little bit about that?
Yeah, this is something that I think we are preparing ourselves as physicians to deal with down the line for several years to come, because we are beginning to see a lot of patients with chronic issues after having COVID infection, especially those who have been through the phase where they were sick enough to be in the hospital, and requiring oxygen or a ventilator or high flow oxygen. They are going through inflammation inside the lungs. And inflammation is basically the virus doing the damage to the lungs. The virus then dies eventually. However, the inflammation inside the lungs continues. So we call it pretty much as inflammation cascade, with different parts of our lungs trying to react, and that reaction sometimes keeps spreading. So with that, there is a healing phase that eventually occurs, which is good news, and inflammation eventually goes away for most of the patients, unless it's severe enough that it affects a lot of a part of the lungs. And then sometimes when the inflammation heals, it can leave a scar. So when the scar is there, that part of the lung kind of can be a source where patients will continue to have some symptoms. And pretty much a lot of patients I'm seeing after 3, 4, 5, 6 months after they had COVID, they're pretty much having symptoms like someone you will have symptoms with asthma. They're having cough, they're having wheezing, they're having trouble breathing or shortness of breath. And this is something that they have never experienced throughout their life, and they'll continue to have those symptoms ongoing up to 6 to 8 months. Good thing is that these symptoms are treatable in most of the patients. We are learning, in terms of doing testing for these patients. A lot of these patients, if they have ongoing cough, shortness of breath, and wheezing that happens, we will do testing in terms of getting a chest X-ray, sometime a CAT scan or CT scan. We'll do a breathing test called pulmonary function test to assess their lung function, which tells us what parts of the lung and overall how much of the damage is there in the lungs. And then we'll treat them with different inhalers, which could include medications to keep the different parts of the lungs or bronchioles stay open, or it could have a little bit of a steroid in it to help the inflammation. And I'm happy to share that a lot of these patients, when we treat them, are responding to treatment. They are feeling better and eventually able to get off the treatment. There is a few of them, I would say so far about 10% from what we have seen, continue to have ongoing symptoms. I have a few patients that have had these symptoms beginning of the last year, and they are still having ongoing symptoms that we are seeing. The large clinical trials and studies are still being done as we are following these patients. So I'm sure we will have more data coming out, which will tell us more about the common symptoms. We'll be able to identify particular age group, particular underlying lung or heart conditions, and then we'll obviously get more data about treatment. But as of now, we don't have a lot of data, since we are still waiting for studies for patients who have been through COVID and how they're evolving over 6, 8, or 10 months or a year. But we are seeing consequences, and I think this is something we will continue to see over the next few years. it is a little bit challenging for patients who have already underlying lung disease, for example, COPD or emphysema, pulmonary fibrosis, or asthma, where if they have infection with COVID, SARS-CoV, their symptoms unfortunately will continue to get worse and their recovery time is a little bit longer. However, for those with healthy lungs to begin with, recovery is faster and we are seeing them to get better.
So when you talk about scarring of the lungs, do these scars eventually go away?
Um, Again, a lot is something we are going to learn over next few years once we see the data, since we are still close to about a year out since the time we have started to recognize SARS-CoV and infection. Scar generally in the lungs, if you look at the data, historical data from patients with flu or pneumonia or pulmonary fibrosis or COPD and emphysema, all these conditions include inflammation in the lungs. And all these conditions will lead to scarring in the lungs. This is similar level of scarring that we are seeing. However, we are seeing it a little bit of a higher magnitude in some patients with SARS-CoV or COVID. But there, all these conditions, when the scarring happens, generally there is some scarring that is left and that does not go away. Now, at the same time, there are therapies being developed for scarring in the lung and for targeting the scarring process in the lung, which involves a little bit of treatment for patients with pulmonary fibrosis as well as COPD. So once these therapies come out, we'll be able to apply the same down the line for scarring related to COVID as well. But unfortunately, if the scarring happens, then generally a portion of the scar will remain in the lungs, and that part of the lung function, unfortunately, is something that a patient will lose. However, lungs have the capacity to do regeneration, and we see that with a lot of our patients with chronic lung disease, severe COPD, severe emphysema, pulmonary fibrosis. A lot of these patients already have 60% or 50% lung capacity to begin with, and they will be able to compensate with the 50% of healthier lungs they have with a little bit of oxygen, and we see them living for decades and even longer. Scarring does not mean that that's the end. The lung has the ability to regenerate and can compensate and can overcome the scarring. But this is something we have to closely watch. So those patients who have scarring will get CT scan on them on 6 months or yearly basis. We'll monitor the parts of the lung which has scarring. These days we can get high resolution CAT scan, which will give us up to 0.5 millimeter images of cuts in the lungs, which will give us a really high resolution image, and we'll be able to monitor them and see if the scarring is progressing faster. So in those cases, we'll intervene by treating them with steroids or other medications. When the scarring is not progressing, stays where it is, then we'll just watch closely. And after a few years, we'll stop monitoring, because generally if it doesn't progress over 2 years or 3 years, then at that point, most of the data we have seen, scarring will not progress anymore, and then we stop doing scanning and further imaging. Yeah.
Are you seeing other organs affected long term?
We are starting to, just like lungs, heart is another one. Patients who developed irregular heart rhythm issues or heart rhythm issues when they are suffering with COVID can have something what we call as cardiomyopathy or damage to the heart, which is similar or close to congestive heart failure. Fortunately, the proportion of patients suffering this damage is very, very, very low. So we are not seeing all of those patients, fortunately, but it can happen. And in those cases, again, we'll treat this patient just like someone who has heart failure or congestive heart failure and monitor them closely. We are also seeing long-term effects for patients who have been on ventilator for days or weeks sometimes, because when they are on ventilator, they will go through what we call as sedation, where we have to keep them up to some degree of sedation so that they will not struggle and they will not fight with the ventilator. The lungs will get time to heal, which is something we need to do. And sometimes with that, these patients will have some neuromuscular in terms of weakness of their arms or legs when they recover and have to go through intense rehab, physical therapy, and most of the patients are able to recover and regain the strength. However, there are some patients who are left with what we call as critical illness neuromyopathy. So when they are sick in ICU on the ventilator for days and weeks, they have lost that muscle mass, they have lost that nerve and muscle function because of lack of ability to move, walk, and they will have longer recovery period, and sometimes some degree of loss of those loss of those functions. However, the proportion of patients seeing that as well is very low, especially from those patients who recover faster within few days or few weeks. But if they are on ventilator for, you're talking about 3 weeks, 4 weeks or longer, then they have a higher risk of having this. Yeah.
We're getting quite a few questions, so I'm going to make sure we have some question time at the end. This is such a great topic, and a lot of people are getting such valuable information and knowledge. Thank you so much. I know you're very busy, so I just want to say I really appreciate the fact that you're taking your time out of your day to answer these questions for us.
No problem. You're welcome.
I do want to talk about what can we do at home. We know there are risk factors such as obesity. What kind of advice would you give the general public about building up their bodies to be stronger, to have a better immunity?
I think lung health in general has a lot of impact with weight overall. If you look at the breathing, the chest cavity is separated from the abdomen, the belly, with a large muscle, which is diaphragm. Diaphragm is the main muscle that really pulls the lungs down. When we take that breath in, it's the diaphragm that really contracts like your other muscles of the body, and it pulls the lungs down, allowing the pressure to be a lot more negative from outside, and the air or oxygen that we breathe in will go in after that contraction of diaphragm. And the diaphragm function is dependent quite a bit on obesity, and especially obesity around the abdomen and the belly. So those who have obesity, higher BMIs, especially when they're higher than 30, every 5 after that, 30, 35, 40, the diaphragm function can be affected by that. So what it will do is, when you are trying to take that breath in, there are portions of the lung, especially the lower parts of the lung and the outer parts of the lung, will not get that stretch the diaphragm will do, and they will not open up. So you pretty much have a healthy lung, but there are portions which will not be able to participate in getting oxygen in because it's not able to open up. So losing weight in these patients makes a huge difference, because then diaphragm will be able to function at the highest capacity, and you'll be able to open those lungs quite a bit. Similarly, weight makes a huge weight gain, unfortunately, affects common lung conditions that we see, like asthma. We have a lot of evidence, starting from evidence among kids as well as adolescents, adults, older adults, that losing weight improves asthma control. Millions and millions of people across the world suffer from asthma, whether it's childhood asthma or they're developing a later part of their life, and they are having difficult time with getting different medications, whether they are tablets, whether they're inhalers. These days we do procedures inside the lung to kind of open up the airways for asthma as well, called bronchial thermoplasty. We are doing a lot of different shots called immunotherapy for asthma, targeting a particular risk factor. However, when their obesity is a factor, especially when BMI or body mass index is higher than 24 or 25, asthma control is difficult. We have seen that in multiple studies across the world. I have seen in many patients. I really encourage my patients when they're struggling, and their asthma control gets better, their breathing gets better. Similar applies to other lung conditions as well as other heart conditions. Similarly applies to diabetes. So weight is one of the areas where not only it improves the heart health or blood pressure control, but it's a huge, huge factor for lung health. And I mean, I cannot emphasize enough. I encourage every patient, everybody to do whatever is possible, whether it's diet, exercise. These days, I know the access is limited to going to a gym or a health club, but you can use YouTube, you can use online access. You can get diet plans, meal plans. There are some patients that have already unfortunately chronic heart and lung conditions, and they have done what they could to lose weight, and then sometimes we are referring them to a bariatric surgery these days, which will help them lose weight, and we have seen improvement in their lung function following that as well. So a weight loss makes a big difference no matter what age, no matter what underlying heart or lung conditions. Big difference. So I'm a big proponent for that. I'll encourage everybody to do whatever they can, and and ask for help, ask your doctors, ask for advice, whatever's possible. And it's difficult. I see a lot of patients who have done that. They tried that. It's not easy, unfortunately. It's a struggle, but I will encourage everybody to push as much as they can and ask for help. Yeah.
Thank you. And that's something that we're working on in our Healing Our Earth community, is working on trying to get people healthier. Next weekend, we have the yoga session, and then we've got the how to eat healthy session. And then after that, we've got wellness and well-being. And that's something that we're really trying to work on in this community that we have here, to get people to eat healthier, to exercise. It is very difficult to lose weight, but even a small amount of weight, just starting somewhere, and that's something that we're going to be helping our audience with. So thank you, Dr. Turek, to bringing that up. What about any vitamins, any things else that we can do to get ourselves healthier?
Vitamins are, this is the question that we discuss quite a bit, and I continue to explore this myself for my health and my family and friends and patients and everybody. We have seen a lot of data over decades coming out on different vitamins for different parts of our health systems, our body systems, and a lot of data coming out lately, especially on vitamin C and vitamin D. There is a substantial data out there in terms of using vitamin D with multiple different small studies across the world, and how it can improve lung health. And similarly applies to heart health as well. A lot of studies out there supporting the same evidence for heart health. For lung health, vitamin D has been found to be helpful in patients who have underlying lung problems, whether it's asthma, emphysema, COPD, pulmonary fibrosis, or if they are taking in general to keep lungs healthy without any underlying lung problems. A lot of these studies are small studies. They come from a lot of centers across the world. We are still waiting for one large, good study in terms of including multiple centers at the same time, and seeing that. However, these studies are not easy to do because you have different doses of vitamin D available. Every small study is done with a different dose. So it's difficult to kind of put one across the board, and but we will be seeing these studies down the line. I think more focus is coming towards doing what we can to keep our lungs healthy, especially after COVID pandemic. And I think more focus is going to come on what can we do to prepare our lungs to stay healthy for any possible viral or bacterial infection down the line, and do our best. Similar data is out there for vitamin C as well. There is some data for using vitamin C in terms of patients with COVID, as well as to use it to keep lungs healthier. It works as an antioxidant. It has been shown to help improve immunity. Similarly, just like vitamin D, the evidence in terms of one large study looking at for prevention purposes, it's still not there, but there are so many multiple studies out there. And there are no so far studies showing any major harmful effects unless you are taking these in excessive amounts. So that's something you want to be careful, and you always want to consult your physician, your specialist when you're taking this, in terms of whether it's safe for you. There are patients who have underlying GI or gastric issues, whether they have underlying gastritis, underlying gastric ulcers. So in those cases, taking particular medications is something you want to be sure taking with your primary care doctor or gastroenterologist. But in general, this is something that has been shown to be helpful. Yeah, but more studies to come to confirm this at a large scale. Yeah.
Thank you so much. I know our time is coming to an end, and I know you have to get back to seeing your patients. We just have a few questions. One question was, are there any exercises that you recommend, for example, pranayam in yoga?
There is some literature available, and actually a lot of literature available in terms of improving the diaphragm health, and especially this is something we use for a lot of our patients who go through pulmonary rehab. So pulmonary rehab is a program that we offer to up to 6 to 8 weeks for patients who have underlying chronic conditions, for example, COPD, asthma, interstitial lung disease, pulmonary fibrosis, or pulmonary hypertension. And we have learned from this data that patients who go through intense exercises to improve their breathing techniques, deep breathing, using their accessory muscles for breathing, which are the neck muscles, as well as learning deep breathing to improve the diaphragmatic breathing. And yoga and pranayam has some data as well. In our pulmonary rehab program, we do have a yoga instructor who comes and helps our patients learn deep breathing, because there is evidence available that it improves their overall diaphragmatic function, and as well as adds to the data we have for those patients who go through intense rehab, 6 to 8 weeks, their ability to walk longer, their ability to using less of their medications, inhalers, and then them needing less hospital care down the line and having faster recovery. So absolutely, it's one of the exercises that will help deep breathing, improve diaphragmatic breathing, and maximize the lung function. Yeah.
Great. I'm so glad that we're incorporating the Eastern medicine with Western medicine. I know next weekend, January the 17th on Sunday, we have our yoga day on healing our earth. So don't forget to tune in, and we can all learn how to strengthen our lungs also. Dr. Chirag, you did take the vaccine recently. How did that go?
I just took my second dose, Pfizer, yesterday, actually. My arm here is a little sore. Last night I took it around noon yesterday, so it's going to be 24 hours in next 3 hours. So far so good. I had minimal soreness after my first dose when I took it 3 weeks back. Was a lot less than the flu shot that annually I do, and yesterday was a little bit more sore. Yesterday evening. I'm on call this weekend and I couldn't do my golf game, so I'm not too sad. I was worried I won't be able to play, but no. But overall, not so bad. I haven't had to take any pain medications. Just tried to avoid sleeping on this side last night. But right now, it's just minimally sore. But so far so good. Yeah. I know I have a few friends, few colleagues, and some data we have seen having some reactions, but yeah, most of them I would say have had similar level of similar experience that I've had. Yeah, so I encourage everybody. I cannot emphasize enough. I know in US we are really pushing for it. We are very fortunate all over the world, US and UK and Europe, that we have access to the vaccine. Companies and scientists, I cannot thank them enough. Pfizer, Moderna, AstraZeneca, Oxford, for working hard at this to get this done so quickly and efficiently, and then producing at a mass level and getting this done. We are very fortunate to have access to millions of doses, and cannot wait for everybody to get vaccinated. Encourage everybody as much as possible. As soon as you get access, please take the vaccine. That's the only way we'll move forward. And I cannot emphasize enough. Absolutely.
Thank you so much. Any last words? I know you talked about the vaccine. Any words of encouragement that you can tell our audience as far as kind of staying safe?
Yeah, I think overall, just like to end with the fact that we still have to continue to remain safe after taking vaccine. As soon as I'm done with this talk, I'm on call this weekend. I'll be putting my mask and my shield on, even though I had my second dose yesterday. All of us across the hospital, all the healthcare workers will continue to take precautions, whether it's mask, whether it's face shield, gloves, gowns. Similarly, maintain our distance as well. So we have to make sure we continue to do good hand hygiene, continue to keep our distance for safety, making sure we wear masks. Because it is something we have to continue to do. It's a duty and responsibility for all of us, and encourage everybody to get the vaccine as soon as they can. Please remember to report to your physician the symptoms we discussed earlier today, whether you want to reach out to them via messaging or calling them, or rush to the hospital for the symptoms we discussed. Do not delay the care, because early intervention, as we discussed earlier, can make a big difference. This is going to be a good year. We are starting to vaccinate as many as possible. We have a lot more better understanding. We will get over this. We just have to hang in there this year. Everybody's got to do their part, and we'll come through. There's no question about it. Yeah.
Thank you so much, Dr. Chirag, for your time. That was just an amazing session. I know we're going to have you on again soon, because you always have such a wealth of knowledge for us. So thank you, and go back and help heal those people out there. Thank you so much for your time.
Thank you so much. Thanks for having me. Appreciate it.
Thank you. So our next guest is Dr. Bharat Pankhania, and he is an advisor on communicable diseases control action plans at the national and international level. He has been featured on CNN, BBC, Sky News, and many other TV channels as a COVID expert. Dr. Pankhania, his experience includes pandemic influenza outbreak planning and major plan testing exercises and development of the web-based surveillance system. He was also a key player in the Ebola and SARS surveillance and control system. Dr. Bharat, how are you?
Namaste everyone, and thank you for inviting me. I'm well and ready to share my knowledge with everyone and make it better.
It's always so good to see you. I'm always watching you on CNN and BBC and all the old news channels. So it's so good to have you on our Healing of Our Earth.
Thank you. Yes, and I hope together, and really it is together, because you help me get the word out, and all I have to do is get the word out, and you are doing the hard work of getting the word out.
So I think it's been a month since we've spoken. What have you been noticing now since the past month? What do you have to share with us?
So the situation, unfortunately, has got critical. It's extremely serious. It's serious beyond belief. And it's so serious that if you were in a war situation, it would be bombs falling everywhere and you would hear them. In this case, we have an invisible, silent enemy that is everywhere. Everyone, every place, every time ought to be considered potentially infectious, and therefore we take measures not to get infected. It is so serious that I have to say, just don't interact with anyone, because the level of infection amongst the community, especially in the London area, is supermassive, and we need to take cover.
What is the situation like there in the UK?
So we've got it's not the same all over the country, obviously, but if I were to focus on the Southeast to begin with, in some places in the Southeast, and I know this very well because I have a sphere of influence in Essex, some of those places have cases of over 1,000 per 100,000 cases numbers. So when you have a situation like that, it's a lot of infection. So in the center of London, There are areas where 1 in 20 persons is infected and infectious. So 1 in 20 means 1 in 5, every fifth person or so is infectious. So there's a large number of people. So the problem is this: the more people that get infected, so it's a larger number of people getting infected, then of that larger number, a proportion will end up in hospital. And that proportion will fill up the hospital, that are entering the hospital. And then of them, some of them will end up on the ventilators, and say some of them will die. So because we are generating a lot of cases, even though the new variant that has emerged in Kent and in other parts of the world like South Africa, Nigeria, etc., even though they are not as more severe disease causing, but because they create more cases, then more people will get ill. So here is a warning cry to take cover. Basically, we've got to take cover.
Why do you think you're getting such an increase in these numbers right now?
So we dropped our guard. We became a bit complacent and we became relaxed. So the cases we are seeing right now is the prelude to Christmas. And the United Kingdom has a habit of spending a lot of money in late November, early December. And the way you spend a lot of money is you go shopping. So you go to your high street, you interact with people, you have gatherings, even if you didn't have gatherings, you're in a crowded place, you crowded transport, etc. And all of those equals seeding. So the best way I can describe it is, if you are seeding your garden with seeds, if you throw 1 kilogram of seeds, you will get a result. But if you throw 100 kilograms of seeds, you will get a huge result. And a kilogram of seeds, if they're full of weeds, you can just about manage. But 100 kilogram of seeds, if they're full of weeds, you won't manage. You just will not manage. So what we've done is we've seeded the population with a infection, and then it propagates. It creates more and more cases. And as a result of creating more and more and more cases, and remember, it's an invisible devil. You don't have to be ill. You don't have to have any signs and symptoms. You don't have to show any signals that you are secreting viruses, but you are, and you are infecting other people. And it's all to do with us interacting too much with other human beings, point one. Point number two, it's colder months. So we are more indoors, and indoors with poor ventilation equals more chance of getting infected. And then point three is that we have a strain in circulation, which allows you to secrete a lot of virus materials, and therefore easier to get infected by it.
So is that what the new variant is? It's just like it's much more infectious because there's more of it. Can you explain that a little bit?
Yeah. So it's very good to sort of be conversant with this. It's very easy to say, I blame all this on the new variant. I'll come on to that in a minute. But the biology is that we know that if you are infected with the new variant, you secrete more virus particles. So instead of secreting, my analogy of 1 kilogram of seeds compared to 100 kilogram of seeds. So instead of secreting, say, 1 million virus particles, if you secrete 10 million virus particles, then there is a bigger chance that somebody standing next to you or sitting next to you in close proximity or in an indoor place or on a crowded bus or a train is more likely to pick it up, get infected by it. So it's that element of you're secreting a lot, therefore you get caught by more of it circulating. It also may be, and I'm not 100% convinced, but it also may be that the new variant it finds it easier to infect human beings. So it's a combination of both. A lot of virus particles, one, and two, these virus particles find it easier to get into your human cells and infect you.
Do you think the new virus particles would be more likely to be more suspended in the air also?
I think so, very much. And sorry, I shouldn't use the word think. I do believe that very much. So it's not a hypothetical. I sincerely believe that a lot of infection is aerosol generated, and aerosol generated countermeasures are difficult to implement. And as they're difficult to implement, we try to do diversion tactics. And the diversion tactics are, we wipe the surfaces a lot, we wipe the door handles, we do all those things that are easy to do. The harder things to do, we avoid or we ignore, such as increase the ventilation, decrease the crowding, wear your mask properly. All those measures, wear your mask properly, difficult. Increase the ventilation, difficult. Reduce crowding in indoor places, difficult. And those are the big issues.
So where does that leave exercising outdoors? Let's say we're going out for a walk. A lot of people, okay, you're suggesting don't interact with other people, don't go to gyms, obviously. But now, how safe is it to go for a walk outside if we've got this very infectious variant out there?
So there is a natural dilution factor when you walk out of the street, out of your house into the street, and there are no humans present. It's perfectly safe because you're not going to be caught by a stray virus if you just walk out of your house with no humans present. The issue is that if you are outdoors and you say, for example, go to London's Oxford Street, Regent Street, or those sort of types of streets or equivalent streets where there is lots of other human beings present, then you have a problem even outdoors. So what we've got to do is, if you are outdoors, for example, in your high street, Oxford Street, Regent Street, your high street, etc., wear a mask, even though it's outdoors. And in answering your question about when I go for a walk, well, if you go for a walk and there's no humans around, it's perfectly okay. And if on your walk you literally just pass a human by very quickly, I think that's also okay. But if you meet another human being and you are spending, say, 10 minutes with them in close proximity outdoors, then I think under the new circumstances that is risky. So what would I do? If I was out on my walk, I still would have my mask with me, because you don't know when you come close to other human beings. So it would be best to say, carry your mask with you, and you interact with somebody on a narrow country lane path or a wood walk or something, and it's unavoidable that there is a long line of these people passing you by. At that stage, put on your mask. But you must put on your mask properly, wear it properly, and then when the crowds have gone, take your mask off.
And wearing a mask correctly means completely covering up the nose and the mouth and having the whole thing over here covered. Let's just remind our viewers about that.
Yeah, Sheila, you're absolutely right. And this is such good, important advice. It's not rocket science. People are looking for rocket science interventions, but your suggestion is extremely important and valuable. So I repeat again, it is a case of you cover it from here, not here, for goodness sake, not here, not at the tip of your nose. It really has to be covered all the way from the top, tight fitting, and underneath your chin. So underneath your chin, over your nose, and all that area tightly covered, snug fitting. So it's good quality waterproof layer on the outside, a absorbent middle layer, and another absorbent cotton layer as the third layer. So a triple layer, good quality mask worn properly will save your life.
Well said. So let's shift to that the topic that everyone wants to know about, which is the vaccine. Now, you've had the vaccine out there for over a month now. People are on their second doses. Are you seeing any side effects of taking the vaccine?
No supermassive side effects that we would be frightened and concerned about. So of course, there are expected side effects, and then there are unusual, unexpected side effects. And the expected is within the normal range. The aching arm, the slight temperature, the slight headache, the slight muscle and joint ache. All those are actually good signs. The good signs are that actually your immune system has recognized the injection, and it's now making antibodies and immunity to it. So that's a good sign. Unusual, frightening, concerning side effects, no, we haven't come across that. Of course, we came across people who have severe allergies to the Pfizer-BioNTech vaccine, reacted badly to it. So we quickly amended the data sheet on that to say people who have several allergies which are of a serious nature ought not to take the Pfizer-BioNTech vaccine. Having said that, overall, the vaccine program that is being rolled out internationally is going well, and we are not getting negative reports.
What about so with the people with the severe allergies advised not to take it, are there any other categories of people that we should be cautioned? For example, the pregnancy, autoimmune, that category?
Yeah, so I would have said initially the Pfizer licensing or the data sheet said, if you're contemplating pregnancy, don't, if you are pregnant, don't take it. If you are contemplating pregnancy, avoid pregnancy for 2 months after the vaccine. And if you are breastfeeding, avoid breastfeeding or avoid the vaccination. All that, by the way, has been amended and removed. So in answer to your question, there are very few contraindications to these new platform of vaccines. Very few contraindications. Let me put it in simple terms. Most people that we know of will benefit from the vaccine. Most people, if not all people. So if you are immune suppressed, you've got organ transplants, you're on a multiple drug regime, you've got conditions, you name it, it will work with most people. Of course, in some groups, it may not be so effective and so good immunity producing, but it really is good that these vaccines are simple but yet powerful tools, and it will benefit most people. Everyone, most people can be immunized.
So we still have a large portion of the population that are either scared or concerned about taking the vaccine. Can you explain in a very, very layman's term, how does vaccines work, and what should we be concerned about, and just alleviate the fears of those that are concerned about taking the vaccine?
Yes, sure. So thank you for asking that question, because it's an important question. So Sheila, really the vaccines do one thing, create immunity and nothing much. So that's really brilliant. Let me take you through how does it work. So the Pfizer and Moderna vaccines, Pfizer, BioNTech, Moderna, are what we call nanoparticles. So they are tiny, 10 to the minus 9, tiny, extremely tiny little particles that encase the code, and the code is the messenger RNA. So the messenger RNA is encased in a lipid membrane, and then that lipid nanoparticle enters your cell. And having entered your cell, the lipid is dissolved and it's denatured, it's gone. Then the messenger RNA is in your cell, and it meets your ribosome, and it has one instruction and one instruction only: make the spike protein. So the cell makes the spike protein of the SARS-CoV-2 virus. And having made the spike protein, it pushes it out. In other words, it puts it on its surface. In other words, it expresses the spike protein. So when the spike protein is expressed on your cell, your body's immune system, which is always looking out. So they're your guards. So the guards are always walking up and down, checking. They do the surveillance naturally. So your guards, your immune system recognizes that this protein should not be here. I've not seen you before. You're not part of the human proteins. You're alien, you're foreign, and therefore I don't like you. So what the immune system does is it attacks it. And by attacking it, it removes it, but it also does one other thing. It forms immune memory. So having formed immune memory, it says, next time you come, I will react even faster and I'll get you. And I'll stop you setting up base in my body. So that's what the Pfizer Moderna vaccines do. Let's just go on to the Oxford AstraZeneca vaccine for comparison. So the Oxford AstraZeneca vaccine uses a chimpanzee common cold virus, which has been altered so it can't reproduce. So it's a chimpanzee common cold virus that has been altered so it cannot reproduce, make more of itself. But attached to that virus is the code, the molecule, the instructions to make spike protein. So if I give you the Oxford vaccine, the virus then carries itself into the human cell. This time it's not a nanoparticle, it's a virus. So it carries itself into the human cell, and then it gets, it undocks, so to speak. It releases itself from the molecule, the mRNA molecule that I was talking about. And then the mRNA molecule goes to the ribosome and does what it does, make the spike protein. So that's how the Oxford AstraZeneca vaccine or the Sputnik Russian one works compared to the Moderna Pfizer vaccine. But the end game, whichever vaccine you are lucky enough to receive, is to create spike protein, make immunity against it, and immune memory. That's how it works.
Can you also explain a little bit about what T-cell immunity is?
Yes, so we have two branches of the immune system. So we have the beta cells, which make the antibodies. They are the chemicals, they are the molecules that go around and find these viruses and disable them. And then the T cells is also the immune arm, but they are the cellular immunity arm. So one is the humoral antibody arm, which makes antibodies, and the other one is cellular immunity. So your T cells, they come in, they're a little bit, shall we say, sluggish in reaction. They do react, they do come, they do arrive, and they do their work, but they are a little bit slower when an infection is presented. But they're also good in that the T cells are also capable of remembering and reacting in the future. So T cell memory making is a good sign that you've got immunity, immunity that will react when a virus is represented to you. So the T cell basically, again, identifies the virus, looks for it and says, you don't belong here, and engulfs it and eliminates it. So they both work in a similar way. One acts as a bullet train and the other acts as a steam train. That's a best analogy I can use to explain the two arms.
So because this virus is the spikes, so even if it evolves, there still should be immunity because it's going to recognize the spike, correct?
Yeah. Yes. So the structural protein of the structure of the spike protein does not alter so much just because you've got a new strain. So the new strain equals, it's got a slightly different use of amino acids, etc., to make the spike protein, but it is still a spike. A spike protein is still a spike protein. It hasn't grossly changed so that your antibodies or your T cells don't recognize it. So we expect that mutations occur, spike protein configuration with which amino acids it's using changes, but the gross structure, biological structure, remains pretty much similar. And because it remains pretty much similar, I expect the vaccines to work against strain A, B, C, D, E. And even, Sheila, in worst case scenario, it doesn't work, say, hypothetically, we can reconfigure the vaccines to mirror the circulating new spike protein and immunize you against that. So I wouldn't be worried about it.
Any idea right now how long the antibodies are going to last in the system?
No, we don't know. But if I were to look at other evidence, then the other evidence of immunity lasting is as follows. Millions of people in the world have now been infected. And of the millions of people now infected, not all of them, or not thousands, not hundreds and thousands of them, have gone on to get a second infection. So that by inference tells me that people who get infected are making immunity and are protected from having had their first infection. So, but we don't know how long it lasts. But we do know that people who got infected in, say, January 2020 appear to be protected in January 2021. So that's good news, that we suspect that the immunity is longer lasting than just 3 to 6 months, as we once thought would be the case.
So what about the people that have had COVID-19? Do they still need to get vaccinated? Because shouldn't they already have some antibodies?
Yeah, lovely question. And we could spend a whole day just discussing this. So my answer is, it's complex matters, but sometimes when you have a overwhelming infection, your body is so overwhelmed that you don't make good immunity or good immune memory following the infection. So getting the immunization, even though you've had the infection, is a good way, a safe way, a safer way to induce immunity of the type you want. So this is another reason why we don't immunize you when you've got an intercurrent illness. When you've got a temperature, you've got illness, you've got an infection, we don't immunize you. But we immunize you when you are otherwise well. And one of the reasons is, just as I've explained, your last COVID disease infection. When you are infected, you may make antibodies, you may not. But by giving you the vaccine, there is a bigger chance that you will make antibodies and immune memory. So in answer to your question, even if you've had an infection, you should be immunized.
Okay, that makes a lot of sense. I know that was a question that a lot of our viewers had when they were asking us questions. We do have quite a few questions at the end, so I'll get to those. As far as what can we learn from the other countries out there? I know you're an international COVID expert. You know, here I'm in the USA, you're in UK. How much collaboration is being done out there for us to work together to find out what's working and what's not working?
Scientists collaborate all the time, which is lovely. I love my scientists because we are not politicians. So that's lovely. Politicians are, on the other hand, awkward. And as you know, President Trump pulled himself, or pulled his country, out of WHO. But I tell you, your American scientists are not stupid. They will still carry on talking to the European scientists and Far Eastern scientists and so on. So global collaboration via scientists will carry on. Politicians will like to draw barriers and boundaries. Now then, in answer to your supplementary question, some countries have done much better than the other countries. So the Eastern countries, the Far Eastern countries, China, Japan, Taiwan, Singapore, Vietnam, South Korea, have done remarkably well. They've done the right things at the right time in the right order, and they've succeeded. Of course, so has Australia and New Zealand, must give them credit too. On the other hand, in Europe and in America, we didn't do the right things in the right time, in the right order, at the right level, and as a result, we are suffering. And I blame the politicians for getting this wrong, because it's not the scientists who were asleep. I'm a scientist. I know all the scientists. I don't know all of them, but I know many of them. And our scientific advice would have been act fast, act early, act hard, and you will get a better result. Our politicians in the West did not do this. This is the price we pay.
So what would you do now? Okay, a lot of the countries have made their mistakes. Moving forward, let's say you had a way of waving a magic wand and organizing this chaos that's going on right now. What would you do?
So you need to get the narrative completely clear. So what would I do? I would tell the politicians to go home and stay at home. I would allow the subject matter experts to at least give the messages. This is important because getting the right message is very important, because the right message gets right compliance. Let's just deviate for a second. President Trump gave ambivalent or contradictory messages. Therefore, you have a large movement of people who say wearing masks, avoiding crowds is not necessary, and that the coronavirus is a hoax. And similarly, we've got ambivalent messages in the UK, and therefore we've also got a large number of people who believe that wearing masks, etc., is not necessary. Coming back to the topic, what would I do if I was the ruler? I would have subject matter experts leading on this, not politicians. Second point, what do I need to do? We're in a crisis. So in a crisis, I need people to stay at home, and I need people to be out of circulation. And I would support them. I would feed them. I would pay their wages. Not everyone has got money to buy bread every day. They haven't got reserves. So you need to pay them. You need to give them money to bring food on the table. So that's the carrot. I'm supporting you. And then there will be the stick, which is, considering I'm supporting you, if you break the rules, you are going to be punished big time. So if you gather, if you go out and mix with other people, if you are creating situations where infections spread, you are going to be in trouble. So I'm going to support you, and I'm also going to punish you. So those are the measures. Third thing, is you need local expertise to lead on local matters. So once you have local experts dealing with contact tracing, testing, and running the outbreak locally, you do a much better job than if you're doing it centrally, like we did in the United Kingdom. And then finally, because of the crisis we are in on the 10th of January, 2021, what would I do going forward tomorrow? Is I would say, we are where we are, case numbers are too high, nothing I can do. What I would like you to do all is stay at home, including schools, including universities, including everything. The only thing that goes out is healthcare workers, etc., saving lives, and a few others, police, ambulance, fire, those sort of things, none other. And I'm going to support you. I'm going to have to give money. I'm going to have to spend money. It's money well spent. And then I would ask non-medical people to organize a good immunization program for me, because medics are good at what medical people do. They're not good at logistics. So I would get a logistics expert. They could be in industry, they could be in the military, etc. And I would organize a efficient immunization program. I'll go one more step. So in the United Kingdom, I have advocated that we immunize 24/7. And the reason why we can't do 24/7 is we haven't got the vaccines in large numbers to have a 24/7 operation. So what would I do? Well, I would say spend some money, authorize a plant, authorize plants, authorize manufacturing plants under license, under royalties, under payment to manufacture more vaccines. Why would I do that considering I already ordered what I need? Well, no one is well until everyone is well. So when I create plants to make vaccines, manufacture extra additional vaccines, it creates a larger supply of vaccines. And having created a larger supply of vaccines, what I don't use, I can donate to other nations. So when I'm well and other nations are well, we are all well. When I am well and other nations are not well, we will never be well. So those are the sort of strategies. You know, you need to be altruistic. You need to think outside the box. You need to think the unthinkable and then do the unthinkable by using expert advice to save the nation. That's what I would do.
Wow, I love to see this great passion that you have, and hopefully the right people are going to be watching this, and we can actually get the word out on how to make these amazing changes that you suggested. The concern now is some people are getting vaccinated, some people aren't getting vaccinated, and then we're trying to get towards more of a herd immunity. How soon do you see this improving and getting better?
So at the moment, the United Kingdom has immunized about 2% of the population. That's just a drop in the ocean. So when we've immunized about 30%, you could start seeing a drop off in vulnerable people admitted to hospitals. So that releases the pressure on hospitals. When you've immunized about 40%, you will start seeing that case numbers are coming down. So that's good. Then when you've immunized about 60%, you should start seeing relief, meaning 1 in 2 are immune. So that's very good. We will have to carry on immunizing. And so this is going to take us through the end of 2021, because now that we have a variant strain, which is in inverted commas, more infectious, we will have to immunize 75, 85% of the population. That is a huge feat. It's a huge undertaking. So when do I start seeing things improving? At the 20% level, at the 50% level, and then 60, 70, 80%. So it is in stages. It's not all on or off. It is that by the time you've immunized about 30%, you could start at least having a sigh of relief that I've got a protected, vulnerable population out of the way. Then 40 to 50%, you say, I have covered most of the vulnerable and at-risk people. Then the hospitals can have a sigh of relief, and then we carry on immunizing. So that's how I foresee it happening. But unless you donate your money and your vaccines and help immunize other people in other parts of the world, you're going nowhere. And that is why I advise and I advocate, pay manufacturers to set up plant, open up plants and start manufacturing extra doses. Just pay and do it. That way you will bring planet Earth to a steady state faster. If you don't do that, because you're only thinking about UK PLC, you won't succeed. You have to think globally.
So manufacturing vaccine, is that a difficult process or is it pretty straightforward? Because I know with Pfizer's one, it has to be a certain temperature. So that it has to be stored at.
So again, as a public health measure, I would, nothing against Pfizer. Pfizer is a good vaccine. Moderna is a good vaccine. It's good stuff. But if I was advising, I would say manufacture the Sputnik, Oxford, AstraZeneca type vaccines, and manufacture them at large scale. They're easy to manufacture, easy to transport, they're cheaper to give, cheaper to administer. They are much better as a public health measure. So that is what I would be advising, that you set up plants and okay, so setting up a plant may cost you 3 months, but after 3 months of 24/7 activity setting up a plant, at least you are producing vaccines in the billions. And what you don't use, it doesn't matter. It's your contribution to planet Earth. And if planet Earth heals, you heal. So it's a worthwhile investment to make.
And they're all as effective as each other. So it's just a case of getting them out as fast as possible, correct?
Yes, absolutely. Yes.
And as far as I know that they're working on another vaccine type, a nasal vaccine. Can you comment on that?
So yeah, it's lovely to see scientists working on different platforms, and the nasal one that I understand is a live attenuated virus. So it's a virus, but it has been denatured so that it doesn't really give you severe illness, and then it's squirted up your nose, and then the idea is it sets up a immune response, a bit like the live attenuated influenza seasonal vaccines that we give up the nose to children. So let's see how well it performs. It is in the experiment stage at the moment, but all platforms are worth considering it, and there is a synergistic benefit. So when people say, why waste money sending man to the moon or Mars, or why does India have a space program, I say this: all that technology that you learn in developing a rocket or a satellite has other uses as well. So with respect to the vaccines, we have other uses. We will make other vaccines that are better. So a better TB vaccine, maybe a vaccine against malaria, maybe a better vaccine, more effective vaccine against influenza, so on. So the more you do of these inventions, the more synergistic benefits there are down the road, cancer therapy, etc.
Got it. And a couple of questions that are coming through I have here is, we have from Varsha Mystery. What would Dr. Pankania say to a person who does not wear masks at the workplace?
Well,
I guess that's you telling them off.
well, I think I need to calm down. So don't get angry. Don't lose your rag. Don't look. So what you got to do is, this has to be a group effort. So it has to be led by senior managers. So I look to senior managers to explain the importance of being safe and importance of keeping all your co-workers safe. So it's a two thing. It has to be led by senior management. It has to be done in a inclusive, calm, informative way that it will protect you and it protects us. So you will comply because we want to remain safe and we want you to remain safe. Therefore, you should wear your mask, wear it properly. We will wear our mask and we promise to wear it properly too. But you must wear it properly. Most people are not wearing masks properly.
So the other question we have is this going to be like the flu vaccine, that every year we have to be taking a vaccine?
Well, I hope not, because it costs a lot of money. I hope that immunity is longer lasting than just a year. And I get the feeling that the immunity is longer lasting than a year. Therefore, I feel hopefully we will get away with not having to immunize every year. Good. We may have to have periodic immunization booster campaigns, maybe every 2 to 5 years. I don't know. But at the moment, I'm feeling optimistic that it won't be annually.
Great, that's great news. Couple of other questions here. What is your take on India COVID infection figures having reduced 6 times in the last 4 months? Sometimes scientists contribute the factor to herd immunity.
Yes, so whilst I have been following the tragic loss of lives in India, sometimes because I work in the United Kingdom, you always sort of wonder about how good the data collection is elsewhere. But what is very interesting about India, and we need to learn something here from the East, is um, how come a lot of people living in very crowded circumstances in slums of Mumbai and elsewhere were somehow spared serious infections and death? Is it that there is a immunogenic factor of living in those circumstances? One. Or is it a case that they are all young people, and as a result, most of them got an infection, got better, but did not die? We need to disentangle this. So what has happened in India? India has got a significant young population. The infection pulse has gone through the population, and it has taken the lives of the elderly, the vulnerable, the diabetics, the high blood pressure, etc. And because it has gone through the population, you probably got an element now of herd immunity. But time will tell. We need to watch out for second, third, fourth subsequent waves, because it is entirely possible that you could have a resurgence of cases in India with second, third, fourth, um, um, how do you call it, outbreaks, national outbreaks across the country.
Yeah, that's really interesting point. I was doing some research the other day, and I was looking at the fact that I was looking into a study that there's a 1,800 genes that are involved in immunity, and it was explaining that the reason that some people are having severe cases of COVID is because there's deficiency in some of these genes, and they're actually looking and they're studying these genes to see what's causing people to have more serious effects and some people to not have any issues at all. So I think that's something that's going to be evolving, and that's what's so exciting about this technology and collaboration, is just learning about all these studies that are out there. Do you have any?
Yeah, Sheila, you're so right. I mean, one could be a student all throughout one's life, and I would say, yes, be a student all your life, because learning is good. So what we will hopefully unearth, if we do, is a certain genome more protective against severe disease? We may find out. So there are clever people working on, if you have a certain makeup, is it protective? And only time will tell that, if you had a certain blood group or a certain inheritance, that it protected you from severe illness because your immune system behaved itself.
Yeah, there's a company in Canada that are actually working on a blood test that you can do now, where they're kind of looking at your genes and they're able to tell you the severity of how it would be if you did get COVID-19. So yeah, it is very exciting out there, and I love reading about all of this information. Is there any advancements out there that you're particularly excited about, Dr. Bharat?
No, not really, but I do remain interested, and I'm not going to speculate, but people are looking at protective effects of certain blood groups. So in time, we will know that if there is any mileage in there certain blood groups being more protective. I don't want to speculate and say certain blood groups are better than others, not at this point in time.
Perfect. I know we have a few more questions. One question is, when you get vaccinated, are you still potentially a carrier? So you still have to wear your masks. Is that correct?
Yes. So a lot of people still have not grasped that the vaccines that we are using are not live virus vaccines. They're not attenuated virus vaccines. There's nothing to do with viruses. So it doesn't give you a infection. It only makes you make immunity. That's the vaccines. Second point, what we don't know fully is, does the vaccine then make you infection sterile or immune sterile is the word. In other words, you never get infected in a large way so that you never have a potential to secrete viruses and infect other people. We don't know that at the moment. So the advice is that even after you have been immunized, you continue with all infection control measures. And the reasons are twofold. One, you could have a mild illness and infect other people who are not infected. Right. Second point is the vaccine might not work on you. And it never works 100% in 100% of cases. Nothing is 100%. So if the vaccine works 95% and you are the unfortunate 5%, you could get infected. So after your immunization, even after your second dose of immunization, you continue with all infection control measures. You only start to reconsider your infection control measures when there is very little viral activity in the community, and we consider it, that the virus is not circulating, or it's not causing severe disease, it's mutated and it's become useless.
Thank you for that. So we actually have a live question from Shivali. Shivali is one of the hosts on Healing Our Earth. Shivali, are you there?
I certainly am. Hello, Dr. Dobe, and thank you for today's session. I'm looking nice and bright and cheerful there, so thank you. And Dr. Pankania, thank you for not only joining us today, but sharing your knowledge, facts, advice with us in such a simple, easy, and logical manner throughout the pandemic, through all your media channels and interviews. We are so appreciative of this. So thank you so much. Dr. Pankania, with the NHS now fighting a war and not a battle, what are your thoughts on the fact that the NHS track and trace system was in place in the hospitality sector? It seemed to be governed well by restaurants. However, this sector has now pretty much closed. Yet the supermarkets and essential shops which are open don't have a track and trace system enforced. Social distancing is also not governed. Do you feel that, especially with this new variant being more transmissible, this is an area where transmission can be an issue and lead to more rising cases during this lockdown period?
Yes, Shivali, thank you for your lovely words. I totally agree with you that this is a place where human beings gather and where human beings are still dropping their guard. And what I despair, So in my sphere of influence, where I have influence, believe me, I'm working so hard. Wherever I can, I'm getting in there. So I'll share a story with you quickly. In my sphere of influence in Essex, I got together representatives, senior managers of these big supermarkets. And I explained to them how people get infected and how they should improve their game. So I said to them, getting your staff to wear a visor is not a good idea. You should get them to wear a mask and wear it properly. And then the second bit was you increase ventilation in your place. Third bit was you reduce the number of people in your place at any one time. And so I gave them a number of checklists and things to do to have a better outcome for their staff and their customers. But I totally agree with you. What we really need is a national directive that supermarkets can be conduits of infections, just like a crowded bus, train, etc. can be, and that you need to get your act together. You need to improve this. So it's not necessarily that you need the contact tracing application to be operational, because people can switch it off and people can misbehave, etc. But it's that clear thing of, you are in my supermarket, you will keep your distance. You will go in, you will buy your stuff, and you will get out as quickly as possible. You could even be pretty strict and say, no wandering around in my supermarket. Show me your shopping list, because if you have your shopping list, you are more likely to perform faster and better. So you could almost say, you're coming to my supermarket, come prepared with a shopping list, and we will help you, tell you, aisle 1, aisle 10, aisle 15, aisle 20. We will even tell you, where your toilet paper, where your cereal, where your bread is, in which aisles. So you can quickly go from aisle 1 to 5 to 7 to 10, pay for it and get out. All of this, if you are interested, can be done, should be done.
Thank you so much. And I think it is very true. It should be done, especially now, like we're saying, the NHS is fighting a war and not a battle. Dr. Pankania, one more question, if I may. All nurseries remain open at the moment. And I think today teachers are now being considered for the vaccination in the next rollout. But for now, teachers cannot socially distance from children. And in a lot of cases, they can't socially distance from each other in a nursery setting. What would your recommendation be to parents, many of whom, like myself, have kept the younger children at home during this lockdown as well?
Yeah, so I deal with this every day because it's also in my sphere of influence in certain parts of the country. And I say, look, if your child is unwell, you should not send them to the nursery. Unwell with any illness. Yeah. So that's the first thing, i.e. obey the existing rules. Don't bring your child if they have diarrhea, temperature, snuffles, off color, off food, etc. Second thing is nurseries create little zones where the people in zone 1 only mingle with people in zone 1, people in zone 2 only mingle with zone 2. In other words, you're creating a safe environment. But having said all of that, nothing is foolproof. It's very difficult. It is a difficult situation. But there are things you can do, like I described, not wanting to take up too much time. Got one eye on it's 1758. So what you can do, and the nurseries are doing it, is create zones. So staff for zone 1 stay in zone 1, staff for zone 2 stay in zone 2, etc. And strict monitoring of don't bring your child to nursery if they're unwell. Having said all that, it's still not easy. One thing I am finding is when the staff go down, finding replacement staff further to post-Brexit is very difficult. We are unable to find replacement staff at short notice to cover nursing homes, residential homes, nurseries, etc. We really are in trouble.
Great, thank you so much, Dr. Pankania, and once again for sharing so much great knowledge throughout this entire pandemic with all of us through all your media channels. It is very much appreciated. Dr. Pankania, thank you so much for answering the questions today.
Thank you.
Thank you, Shivali. Thank you, Shivali. That was nice meeting you, and thank you for those very, very wonderful questions. Dr. Bharat, we don't have a time restriction for you because we put you at the end because we knew that everybody has all the questions to give you. So do you have time to spend a little bit more time with us?
Yes, I do. I was rushing because I assumed the clock is telling me to get off at 6 o'clock.
No, we've got, we do have another question from Dr. Nora, our very own Dr. Nora there. That was one of our speakers earlier, and she's one of our hosts. Dr. Nora, would you like to go ahead with your question? Dr. Nora?
Yeah, thank you so much, Dr. Dobie. It's a pleasure really to be able to listen in or tune in to Dr. Pankania's talk. Thank you so much. It's been such a wonderful session. Informative. Can you hear me?
Yes, we can.
Hello?
Yes, we can hear you.
Hello? Hi.
Yes, we can hear you, dear.
Can you hear me?
Yes, we can.
Thank you. Dr. Bharat, Dr. Poet, it's been a pleasure. Thank you so much for the session. It's been really informative. I just have one question. It's relating to diabetes. So there is this general sense of a lot of worry, a lot of concern in individuals who have a medical condition such as diabetes about whether to take the vaccine. What advice would you give to individuals who have this condition?
Oh, it's so, namaste, Nora, thank you. It's an easy question, easy. Of course you take the vaccine, you're in a vulnerable group, and diabetes puts you in a vulnerable group for everything, you know. What can you do? Us Indians, we get a lot of diabetes. Please take your vaccine. It's very important. The vaccine is not going to harm you. All the vaccine can do is protect you. So take your vaccine. Don't sit there thinking, I've got diabetes, blah, 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 blah. I'm not taking the vaccine. If you get an infection, you could be in trouble. Take it.
Thank you so much. I think that's very useful for those who are tuning in and those who may just generally be anxious about having a medical condition, a lifelong condition, and looking into strategies of what they can do. So I'm sure that's a relief for many.
Thank you.
So, Dr. Para, do you have any words that you'd like to share with our audience? Any words of wisdom?
Yeah, so we are in the middle of a crisis. So with respect to the crisis, all I can say is, if you can avoid going to the supermarket, avoid it. If you can send your younger sons and daughters to the supermarket, you must. If your younger sons and daughters and others are going out and about, then tell them not to mingle with you if you are in the older age group. And you also tell your sons and daughters not to mingle with other people. In fact, I'm telling everyone, now is the time to save your lives. Go home, stay at home, don't interact with anyone. Just, call it a day. You need to lock down for, at least a month. The situation is very critical. The advice, if you're out and about, is get yourself a very good quality mask. A flimsy piece of tissue paper type, fabric is rubbish. A fabric like this one is also rubbish. Please, even a well-made mask. This is a triple layer mask, right? That's pretty good. Yeah, that's a look at it. Look at this, right?
Looking great there, Dr. Bara. Looking wonderful.
But it's just on my desk, and I promise you, this wasn't pre-planned. This just happened to be on my desk. But look at it. For goodness sake, it is tight fitting. Look, yeah. You do this, right? And then you pull it. You hold it there, and you pull it down. So it's covering my mouth. And look, there's no air gaps here. No air gaps here. No air gaps here. It's snug fitting. That's what you need to do. You can't wear a mask that's not snug fitting. And the mask is not 100% protective. So even if I'm wearing that, it is not a guarantee that I will be safe, but it is safer. So go home, stay at home. If you have to go out, wear a good tight-fitting mask and don't interact with other human beings. Finish, don't do it. Then take the advice of the 3 C's that Japan has. Avoid the 3 C's. Avoid getting close to other human beings. Yeah, point 1. Avoid getting into crowds of human beings. That's 2. Avoid getting into a closed space. That means poorly ventilated. So too many people indoors, bad idea. Getting close to people, bad idea. Getting amongst crowds like your buses and your trains and your shopping centers and your supermarket, bad idea. So avoid the 3 C's, wear your mask properly, wash your hands, and one more thing, be positive, eat well, sleep well, exercise well. These are important things. This is a war, so you need to have your mind working properly. So eat well, sleep well, exercise well, because when all this is over, I want to see you alive. I want to see you alive and well, and then we will celebrate. I mean, there are so many um, um, parties that we need to celebrate, good things that we've all done. So I want to see you all alive. So keep alive.
Dr. Barrett, you're a great cook. You've sent me some pictures of your good cooking. So you've promised me that when this is over, that you're going to be cooking me a good meal. Is that right?
That is a promise I intend to keep, and we will fly you over all the way from the United States to our garden, and we will celebrate, making a difference. And this is important. We've all done, making a difference, and we should celebrate it.
Perfect. A few more questions. Eye protection, how important is that?
Eye protection?
Yes.
So in a sensitive setting like yours, for example, you are a dental surgeon and you are doing things which is close inspection of people's mouths, you must wear eye protection. It's important. For ordinary members of the public, if you want to wear a visor on top of your mask, be my guest. Nothing to stop you doing it. But it's otherwise a low risk activity. Of course, if you're an optician, a dentist, a surgeon, a clinician, close face-to-face encounters, do wear your shields and your masks. But for ordinary members of the public, I don't think it's that necessary.
Got it. And Dr. Barrett, what are you doing to stay safe during this time? Obviously, you're staying home. What about your diet and eating and vitamins and anything else that I'm sure you're getting enough sunlight. That's important for vitamin D. What can you just share with us some tips from the world COVID expert?
Yeah, so unfortunately, I'm not practicing what I preach, and I can do better. And my reasons are I'm working very hard. And as a result of working very hard, I'm missing out on sleep. And I need to readjust this. I'm not good at saying no. So I am failing on the sleep front. Unfortunately, we are in the darker months. So going out with no sunshine is not a good idea for vitamin D purposes. So to mitigate over there, I decided to supplement my diet with vitamin D. So if you take 1,000 units of vitamin D every day forever, that's fine. I was reluctant to promote taking pills because really we should have a good diet. But in the United Kingdom, a cold, dark country, 6 months of the year, many of us Indians are also vegetarians. So the diet doesn't supplement the vitamin D. So I thought about it, and now I have changed my mind and said, take vitamin D pills. I can do better. I know I can do better, but I'm working so hard that it's stopping me from looking after myself.
Well, you better start looking after yourself because you've got big changes to do in the world. So no more excuses, Dr. Barrett.
Yeah, it's so difficult because you are busy, giving media and advice and all that. And then, of course, I have my job at Exeter Medical School as well. That basically I've gone short on sleep. I can see the tiredness in my face.
And sleep is very important for immunity, as you know. So you've got to keep your immune system boosted. So you need at least your 8 hours a day. Yeah,
and although whilst I might not be doing it, I advise everyone that you need to have a good bedroom and sleep well. This is important.
Perfect. So a couple more questions we have. Dr. Barrett, any recommendations on the 2 vaccines as it's new technology? Is one better than the other?
No, they're all as good as any. And my advice would be take whichever vaccine you're given. Um, I want you to imagine this as a shower of stray bullets. So, and the bullet represents the viruses. So if you've got a shower of stray bullets coming and going, coming and going, coming and going, you don't want to get hit by a stray bullet. So what do you do? As soon as you can, as fast as you can, any vaccine that you're given, take it. There is no superiority, inferiority. You just want to be protected from severe illness and death. All the three vaccines protect you from severe illness and hopefully death. So take whatever is given.
I love your analogy of the bullets, because I think the biggest problem is because you can't see it, you just kind of take it for granted. You don't know where it is, the virus. So the fact that if you look at it like it's just out there and just shooting at you, if you put your mask on, you're not going to have it in your face. If you're washing your hands and you're not, when it lands on the surfaces, you're protecting yourself. But that's a great analogy. I think we all need to remember that it's invisible, but it's just shooting at us from everywhere.
You're so right. But if you look at historic, then people did the right thing. So go back after this seminar and look up how people dressed for when they had the plague in the United Kingdom, and the people at that time when the plague was around dressed in a special specific way, and they did things in a special specific manner because they considered everyone, every place, every time as infectious. And I said this on the 7th of March. It's indelibly written in my memory. So 7th of March 2020, I was being interviewed by one of the newspapers that I don't normally want to read either. So it was one of those not nice newspapers. And I said to them, you must consider that everyone, every place, every time is infected and infectious, and act accordingly. And if we had followed that advice in March 2020, we would have been in a better place.
Yeah, that is true. Unfortunately, this has been dragging on because many people aren't doing what they're supposed to do. Isn't that correct?
Yes, indeed. And again, it requires our political leaders to get serious about this. So when I advocated a 24/7 immunization program, it is a reason for doing that is to show that we mean business. We are serious about this. We are so serious that we're going to run the program 24/7. And the countermeasures are, we're very serious about you behaving and taking all necessary precautions. We are going to support you for people that are in lockdown, and we want to get out of this lockdown as soon as possible. And the only way we can get out of this lockdown as soon as possible is to do all these things together as well as possible.
Thank you so much, Dr. Bharat. Can you give us some word of encouragement for those people that are feeling a little bit stressed out? Obviously, we had a session earlier about COVID and the vaccines, and it's taking so many months and months and months. Can you give us just some last ending words of encouragement and advice?
It will get better. You have to look at this as a long-term game, but it will get better. And because it will get better, you just got to say to yourself that the next 3 to 6 months, and it's only asking you for next 3 to 6 months, then we will see. I will keep safe. So my bottom line is, it will get better. Just keep patient, be positive, eat well, exercise well, sleep well, and things will get better. And when things get better, I hope we will still continue meeting on healing our earth, because there is a lot of healing to do. Global warming, nutrition, water shortages, water supplies. so many other things that I also do as part of my work. I want to share with you. So just hang on in there, it will get better.
Thank you so much. And yes, Healing Our Earth will be continuing because we've created this amazing community and meeting people as wonderful as yourself. Thank you so much. Our director, producer, Neil Kumar wants to thank you so much. Our entire team from Healing Our Earth wants to thank you. And we feel very blessed to have someone like you on our team helping us spread the word and the great advice that you're giving everybody. Thank you so much.
Now, I thank you all for giving me the opportunity to share good practice. And I hope together, it is together, it's not my job, my efforts alone, it's together. I hope together we will have saved a few lives. Isn't that lovely? To feel that together we saved a few lives. That's a lovely thought.
Thank you. And you're going to be joining us again, hopefully in the next couple of weeks, I'm sure, to give us another update, right, Dr. Bharat?
Indeed. So before I say goodbye, I'm not looking for followers, but I really want you to follow me on Twitter or on Facebook, whatever. Maybe you can tell the audience about my Twitter handles and things, because I think it is important that you do, because I'm putting up updates every day. And I think a little update every day helps you to get that confidence of what to do, how to do it, how to look after myself.
Do you want to share your Twitter handle and your Instagram handle right now, live, please?
Yeah, so my Twitter handle is at Dr. Saib, DoctorShaib. And the YouTube channel is basically, if you go to Dr. Bharat, Dr. DoctorBharat, Pankania, Pankania. So on the YouTube channel under Dr. Bharat Pankania, I try my best to upload all useful interviews and media exposures, etc. So people can read it or hear it or watch it and just get more confident that this is what we need to do. This is where we're going.
Thank you so much. And thank you for all the advice that you give us all the time on all the different news channels and gracing us with your presence. Thank you.
Thank you. Thanks. Goodbye. Thank you.
And now we've got a few more minutes left over. So me and Dr. Nora are going to just conclude the session. How are you, Dr. Nora? Are you there?
Yes, I am. How are you?
I'm great. I just had these conversations are so enriching. I mean, you can spend hours and hours speaking to these experts about all these different topics. It's so amazing to get such a great opportunity on Healing Our Earth. I didn't get a chance to listen into your session. I was sleeping because it was like 6 a.m. for me. But I did get the tail end of it with all the wonderful practices that you shared with us. And I love, my favorite thing to do is the gratitude exercise. I think that's a really valuable, important tool that people just don't do enough of. We often get used to complaining about things. In fact, the other day I was reading a really interesting article that gratitude actually changes your brain chemistry because of you actually release special hormones when you're practicing gratitude.
Yeah, absolutely. And during the session, I was talking about whether we could use like a small piece of paper and to add that into a jar. And we just see that jar filling up. And that brings a lot of happiness in our lives. And additionally, as we progress through, through the months, which I know is quite challenging at the moment, we can literally just pick up one of those pieces of paper and go, oh, wow, this is something I did 5 months ago and it brought me a lot of happiness, or this is something I'm most grateful for. So I think in general, I think it's quite important that we have an attitude of gratitude. And that sounds, quite catchy, but it's true. And it does really give us some form of purpose and tries to maintain a very positive mindset.
Yeah, I like the attitude of gratitude. One thing that I like to do is before I go to sleep, I try and find 10 things that I'm grateful for. And it can be as simple as the food that you get, the oxygen that you're breathing, the fact that you can see, just very basic things. But I think that's really important to kind of remind you of just, yes, there could be a lot of stresses in your life, especially right now. There's a lot of people going through so much anxiety and depression, as you well know. If you're starting to focus more on the positive, you change, you rewire that mindset so that you're starting to think more positive thoughts than negative, right?
Yes, absolutely. So having some sort of a way of being able to detach yourself from the external factors can really help. So meditation is one thing, but also, just like Dr. Poet was mentioning, because it's really cold over here, and I know it's quite sunny where you are, but it's extremely cold. The sun doesn't come out very much. And so I just recommend to everyone that when the sun does come out, try to take in as much of that natural light as much as possible. Go out for a walk, even if it's a short one, just to relax yourself and to get that fresh air, which you don't really get very much when you're indoors because it's so cold. People don't open their windows as much. So there is a natural something that we can do, which is quite simple. But I think all the suggestions that we give on this program are also quite straightforward. It's easy to follow as long as we can practice a couple of these. So it's just really nice to be able to listen to all the talks. And of course, for those viewers who are tuning in today, there might be something that you can take from each of the sessions. So just be very light, be very relaxed, whatever works for you, try to apply it in your life. And again, I think in the session I was talking about social media, like exposing ourselves too much to the media could be quite stressful. So don't be, excessively using, going online, using lots of apps. Just try to reduce that a little bit because it does help with our sleep as well. So yeah, that's a couple of things. But how are you doing, Dr. Dobie?
Oh, I'm doing really good. I've just been working, still seeing patients and taking care of patients, trying to get them healthy. And I'm also kind of really trying to educate them on like losing weight and how to eat healthy and eating the right foods. A lot of people are eating way too much processed foods. I'm noticing a lot of my patients have gained at least 15 to 20 pounds. So it's really important to try and get everyone healthy, I've noticed. And what about you, Dr. Nora? How are you doing out there in the UK?
Yes, I think I am working from home. I've been doing that since March last year, so it's been a long ride. But I think, just like Dr. Pankani was mentioning, it's important that we realise that there is light at the end of the tunnel. Things are improving. We do need to have faith in the scientists, like all of us. We're all scientists. And, over the next couple of months, we will be easing off, hopefully, from the lockdown, and things will not come back to normal completely, but at least some form of normality. So I was just thinking about whether we could do a short meditation, if that sounds okay.
Yeah, absolutely. I love because I missed your meditation earlier. I was going to suggest let's do a meditation session for the audience and for me also, because I love those sessions. Yeah, let's go do that. Let me get my eyes closed.
So I just want to bring a bit of attention that we don't have music, and that's completely fine. Okay, just sit comfortably on your chair, inviting my senses to relax, appreciating the work that I do. I now choose to give them a break. Let's relax. Taking just a minute, I stop. I start to relax my body completely. I take a deep breath in and out. I begin to breathe slowly. In this moment, with one thought, I refresh my tired mind with the thought, I am peaceful. I am tranquil. I am in a serene state. My mind receives a new breath as I take a deep breath in and out. My mind relaxes, feels refreshed, and I remain in this deep breath of fresh thought, peace, tranquil, and serenity. When I'm ready, I bring my attention back to what's going on around me. Thank you.
I was about to fall asleep there. That's lovely. So
Yeah, I remember one of our chats. I remember a couple of our chats a few weeks ago, and it's just about when you meditate, it's an alpha state. So we do tend to be at that critical point, whether we could either fall asleep or we could be like just able to concentrate and feel relaxed. So it's something I tend to do just before going to bed at times, not necessarily a commentary, but just a way of maybe focusing on my breathing, and it just makes it so much easier to have that a fresh breath of air, not very many thoughts, and it just calms the mind and allows us to have a good night's sleep.
Yeah, I've always struggled with meditation. I think it's just like I think about it in a conventional way that you have to sit there and not think of anything. And in fact, what happens is I start thinking of everything because I'm like, wait, I haven't done my dishes, I haven't done this, I haven't done that. But these short meditations that you do are a lot easier because you're listening to someone else's voice. So for anyone that wants to go back to this, all of these sessions are all recorded on Healing Our Earth and on that website, www.healingourEarth. And everything's recorded. You can go back to all the sessions, including your session from earlier, Dr. Chirag's session, Dr. Bharat's session, and then you can kind of share it with your friends and share the good work that's out there. But there's a couple of really good sessions coming up soon. I think next week is yoga and meditation, right? So probably figure out some easy ways of doing meditation to not make it so complicated for us. And then
Yes.
after that we've got the cooking one, correct?
Yes.
And
you know more about that, Dr.
Yeah, I started to be I used to eat meat, and then now I've kind of the past 2 years I've cut down a lot of the I'm kind of moving to that vegan kind of diet, and I've noticed a huge shift in energy. All my blood work has come back really well, and it's really made a big difference to me. A lot of weight loss, a lot of just really been very helpful for me. What do you do to keep your mental state healthy, Dr. Nora?
This is a rapid fire round, Dr. Dobie. I'm just joking. So what do I do? Something that I practice is I meditate. I meditate quite regularly, maybe a few moments a day. Typically it's in the morning because that really does allow me to feel relaxed. It allows me to subsequently after the meditation to focus on what I need to do for the day. Something else I do is I try to limit any like teas and coffees after 4 or 5 o'clock, because I know it has an effect on how I feel. Like I find it affects my sleep. So that's something that I've applied. And just generally doing something in the day that I quite enjoy. It could be reading a book, which I'm trying to get through, which is The Unlikely Pilgrimage of Harold Fryer. That's a book that I'm reading at the moment. So just finding a time, it could be an hour or so, which I can integrate within my day to essentially give myself some me time. Additionally, of course, I work as well. So I'm teaching, I'm an academic, so it's like managing, preparing for lectures and that kind of thing. But in all, I think it really comes down to do things which you quite enjoy, that makes you happy, even if it's going out for a walk, if it's reading a book, taking care of your pet, whatever it may be. Acknowledge to yourself that this is something that I quite like. Acknowledge the situation we're currently in, the COVID situation, the lockdown, and then try to come up with a plan of what works for you, and then draw up a routine. And that's something that I'd recommend to everyone. But yeah, these are a couple of things that I quite like doing. But I'd actually like to thank you, Dr. Dobie. I think the session was amazing. I'd also like to thank Dr. Milind Shah. Again, both hosts have been incredible, and today's event, which is a COVID special, has been extremely informative, and I'm sure that the audience will join me in thanking all the speakers and, of course, the hosts who've been providing some incredible questions over the last many hours. So thank you so much.
Thank you for joining us at the end, Dr. Nora, and your session was also really wonderful. I always learn so much from all these sessions, and let's not forget, let's go back and get the recordings and share them with your friends to help heal our earth. Thank you so much for your time, Dr. Nora, too. And I would like to say to everybody, it was such a pleasure having you as an audience. Thank you for spending your Sunday with us all across the world. I know we're in many global countries here. Thank you so much, and a global namaste to everybody. Till next week, we will see you then. We are part of your family. It may be a difficult time right now, but we are here for you, just trying to help your world get a little bit better during this difficult time.